The Senate will come to order. Members, please stand for the prayer. Today's chaplain is our very own Senator Andrew Matthews from Senate District 15. And following the prayer, please remain standing for the Pledge of Allegiance.
Good morning. Let's pray. Lord, thank you for the many blessings that you have given to us. I'm thinking of the verse from the old hymn this morning, to count your many blessings, name them one by one, count your many blessings, and see what God has done. And I ask that you would help us to count our blessings even in the midst of these difficult circumstances. Lord, I'm grateful for the time I've been able to spend more at home with my wife and young baby as I'm doing my work from home. And I ask that you'd help us to step back and consider and enjoy the blessings of family and of friends that we've only been able to see through social distancing means or through video conferences. Thank you for all the benefits that we've enjoyed that are on hold right now, and would you give us more of a gratefulness for them, to not take things for granted, but to be grateful for all the blessings that we enjoy. Lord, would you help us to count our blessings? Again, I ask that you would be with those around our state, caring for those that are ill, those that are in the hospital. Again, we ask for your healing. We ask that you would pour out your blessings all over the state of Minnesota, all over the communities we represent. And we thank you for what you will do. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
The Secretary will take the roll.
Senators Abler, Anderson B., Anderson P., Bach, Benson, Bigham, Carlson, Chamberlain, Champion, Clausen, Cohen, Swazinski, Dames, Dibble, Draheim, Dietzick, Eaton, Eichhorn, Eakin, Franzen, Friends, Gazelka, Goggin, Hall, Herr, Hayden, Hoffman, Housley, Howe, Ingebrigtsen, Isaacson, Jasinski, Jensen, Johnson, Kent, Kiffmeyer, Klein, Coran, Lane, Lang, Latz, Limmer, Little, Marty, Matthews, Miller, Nelson, Newman, Newton, Osmick, Pappas, Pratt, Rarick, Ralph, Rest, Rosen, Rude, Senjum, Simonson, Sparks, Tomasoni, Torres, Ray, Utke, Weber, Westrom, Uyghur, Wickland.
A quorum is present. Pursuant to Rule 14.1, the following members intend to vote under Rule 40.7. Senators Anderson B., Bigham, Carlson, Clausen, Dames, Dietzick, Eaton, Eichhorn, Hall, Housley, Ingebrigtsen, Isaacson, Johnson, Klein, Lang, Lane, Latz, Newman, Newton, Pappas, Rest, Senjum, Sparks, Torresray, Weber, Westrom, and Wicklin. And members, just a reminder, we will be operating today the same as we have the past few times in the Senate chamber under CDC and MDH guidelines, including proper social distancing. Members who are not in the chamber, when it comes time to vote, when your room is called, please enter through the side doors of the chamber, vote at your own desk, and then exit the chamber through the front chamber doors. So enter through the side, exit through the front after you vote at your own desk. And if members in alternate locations would like to offer an amendment or provide discussion on a bill or any other business in front of the Senate, please notify the front desk. They will then notify me, and we will make sure that we give every member an opportunity to provide input on the business in front of the Senate today. So with that, we will begin on the Senate agenda with the second order of business, executive and official communications. Please make note of the communications listed in today's agenda. There's no further action required on those communications. Moving to the third order of business, messages from the House. The Secretary will read the messages.
Mr. President, I have the honor to announce the passage by the House of the following Senate concurrent resolution herewith returned. Resolution number 7, a Senate concurrent resolution relating to the adjournment of the Senate and the House of Representatives until the public interest warrants reconvening. Mr. President, I have the honor to announce the passage by the House of the following Senate files herewith returned. Senate file number 4489, a bill for an act relating to liquor, allowing certain on-sale licensees to make off-sales of liquor. Both messages signed by Patrick D. Murphy, Chief Clerk, House of Representatives.
There is no action required on those messages. Moving to the fifth order of business, reports of committees. Please make note of the committee report listed in the agenda. There's no further action required on that business. Moving to the eighth order of business, introduction and first reading of Senate bills. Listed in today's introduction calendar are Senate files 4490 through 4502. There's one change. Senate file 4493 will be referred to the Committee on Judiciary and Public Safety, Finance, and Policy. These Senate files are given their first reading and referred as indicated. Moving to the ninth order of business, motions and resolutions. We have one author's motion listed in the agenda. All those in favor of the author's motion say aye. Opposed say no. We will take a pause to gather the votes from the alternate locations. Receiving a sufficient number of aye votes, the motion prevails. Senate Resolution number 231 will be referred to the Committee on Rules and Administration. Remaining under motions and resolutions, we have a motion, Senator Rude.
Mr. President, I move that the appointment withdrawn from the Committee on Environment and Natural Resources Policy and Legacy Finance and placed on the confirmation calendar under Senate Rule 8.2, reported in the Journal for April 20th, 2020, be returned to the committee from which it was withdrawn. That is the Minnesota Pollution Control Agency Commissioner Laura Bishop.
Discussion on the Rude motion. Seeing none, all those in favor say aye. Opposed, say no. Again, we'll take a brief pause to gather the votes from the alternate locations. Receiving a sufficient number of aye votes, the motion prevails. Senator Abler.
Thank you, Mr. President, and I would like to make a motion. I move that Senate File 4200 be withdrawn from the Committee on Finance, given a second reading and placed on general orders.
To that motion, Senator Abler, discussion?
Thank you, Mr. President, and this frankly is a desperate motion in times that people feel actually quite desperate about. The base bill was actually worked out in one of our last committees. We're giving the Commissioner of Human Services the authority to do all kinds of suspending of standards and ratios and payments, and it has failed to become law, to my sadness. In its place, the governor did an executive order, which I think is a really good move on his part, with the caveat that he's not really allowed to suspend statutes. And so what he has done through that order has been to suspend statutes and go beyond his constitutional power. And moving this bill is my effort to get that back on track and restore the proper balance. And that's why I bring it forward. But, Mr. President, it's a desperate motion because there is no House companion. I don't have an agreement with anybody to take this forward. And my people sit home and they wonder what's going to happen to them. And so I'm not real optimistic about the future of my motion, Mr. President, as many of the people living in my district are not optimistic about the future of their family. The only place they can go shopping is Walmart if they want to buy shoes, and I wouldn't take my grandmother into Walmart. I wouldn't take Senator Hayden's mother-in-law there. I think that would be a really unwise act. Peterson Shoes on Main Street has a very nice store, and they have like one or two staff, maybe one, and then 2 or 3 people wander in every hour, and it's really safe, but they're forbidden to be open. And so this is my 5th talk on this very topic, wondering how we can help Minnesota be actually safer than it is now, and actually try to help some of these folks escape what is about to come to their business and their families and their legacy. And so there is a great deal of despair out there, and including, you can read in my tone, where people need hope. There's a lot of fear where people need confidence. And we don't want to rely on the government to open our stores up and to be sustaining. In fact, government doesn't have enough capacity anyway. The money, $350 billion, was put out to help small businesses. Some was sucked up by large businesses, which to me is just wrong. But those funds are dry. And people that tried to maintain their staff are now not going to be able to. Unemployment is going to run out after a few months. And what are we going to do then? And so there is no reason to make the hole any deeper from places that are actually safer than the places that are available now. And we talked about secondary effects. Just so you know, we're very worried about people dying from COVID, and I share that. We take this seriously. Let's get testing going. Let's find a way to deal with the hard matters that are before us. How do you open a stadium? How do you get a pork processing plant to be safe? How do you get the bars and other places to open? But some of the questions aren't really very hard. And if they're really quite safe, let them do their work. The people are already choosing to not go out. And we actually have a really kind of set of conflicted messages that are there. Stay home, says the governor, and that was a good thing right in the beginning. But now the slogan, Reopen Minnesota, is catching on. But what do either of those mean? I was told by Commissioner Groh that only that 80% of the people are still working somewhere. So some are working from home, some are going to work. So when they go to work, they're not staying home, and they're kind of open. And there's places that we want to reopen to figure out like how the Twins can play and so on. And that's kind of a reopen message. And so I think it's time to try to blend those messages and find a way to make it work in a practical way. Domestic abuse cases are way up. Now, that's a victim of this time we're in, unless we just care about people with COVID. But I might care about, I'm the chair of the committee that worries about what happens to a family where the two parents or the one parent is so strapped they don't know how they're going to make it. They take it out on their kids. They start hitting them or being mean to them. Now, is that not another victim we should worry about? A friend of my friend took his life last Wednesday because of all this. And how many more are doing that I don't know about? Does that not matter to us as well? Stay home, reopen. The people that came to your mansion, President, yeah, it feels like a president, Governor Walz, and that, I watched the Twitter about that. And a lot of them were just there because they were so despairing and frustrated, not knowing what to do, so they stormed the equivalent of City Hall. But when you, Governor Walz, said that was impugning the work of my friend Mary Turner in her at the hospital, they had no thought of that at all. They just don't know what to do. And so it's really important. And so I watched Twitter, and they were just saying all kinds of good and bad things. They're great, they're horrible, they're disrespectful. What are they thinking? They should be arrested for violent behavior because they're like, what if we look behind the actions at the concerns of the people? And Governor, that's your job. You represent 5.5 million people. I represent 80,000 people. They vote for me, they don't vote for me. I care about everyone. And the only way to get this on track is to peel it back and say, how are people acting out? And it's only going to get worse. In one of the European countries, they were using nightsticks on people that wouldn't social distance. I hope we don't go there. That's not what we're about. But so, Mr. President and members and whoever else cares to keep listening about this, we've got to find a way to do the safe, easy stuff and get that out of the way. And then I'll quit talking about opening mobile dog groomers. Do you know mobile dog groomers can't work? They're going to drive up in a van, and you'll bring the dog out, and the dog will go in the van with whatever they do to dog grooming, and a little poodle will look better. And maybe the lady can get a trim while she's at it. But anyway, so they can't work. And the family that relies on that little business, are they caring about people's COVID danger, that they're going to somehow harm somebody and really make it a problem? They want their dog to look nice, and it's not bad if the woman or the man who's doing the grooming gets the business. So, Mr. President, this is a desperate act, but in times that are very desperate for the people that we all swore to serve.
Mr. President, point of order.
So, Mr. President, I'll stand for questions.
Senator Hayden, for what reason do you rise?
Well, Mr. President, I just wanted to just ask a simple question and then maybe some comments after when it's my turn. I just wanted to yield to Senator Benson, if she would.
Senator Benson will...
Well, let me just move forward. I just want to see if Senator Benson
Senator
is
Hayden.
comfortable with the motion that Senator Abel has put forth.
Senator Benson, I guess that's a question for you. Senator Benson?
Mr. Chair and Senator Hayden, respectfully, this hasn't been referred to my committee and it isn't being it's being withdrawn from the Committee on Finance. Generally, I support the work that was in 4200. It was done by executive order. I would have liked the legislature to take a position on it. So I don't have a fundamental problem with the motion. The content of the bill does have some things that will make people nervous, giving a great deal of latitude to a commissioner. This has largely been implemented by executive order. But I think to Senator Abler's point, he has worked very hard to make this strong point that the legislature needs to be involved in the executive order process, and we need to be further engaged. And I think that's where some of his conversation about the motion is going, that we need to be more directly engaged in decisions that impact Minnesota. I don't have a problem with the motion, but I would prefer that it stayed, that Senator Abler would leave it in finance until we figured out how we're going to pay for this, given that we have $300 million in extra federal matching. It would be nice to have some transparency as to where the federal matching money is supposed to go.
Further discussion on the motion, Senator Hoffman.
Thank you, Mr. President, and thank you, Senator Abler, for bringing a highlight to Senate File 4200, which we all agree is something of importance to not only folks with disabilities in the state of Minnesota, but those home and community-based service providers in outstate Minnesota. And there's a couple of things that needs to be addressed in that. And yes, thank you, Governor, for taking Senate File 4200 and making an executive order on that. There is still a need for us to handle that legislatively, because there are still some things within that Senate File 4200 that need to come to full fruition. And number one, when we talk about how we're going to fund this, there is the ability for us to use already state formulaed money that is already budgeted without having to do the federal match. There's a way to get approval from CMS to do that, because if we don't, Senator Abler's correct, and throw a lifeline to those organizations out there, there's a future problem that's going to exist, not only just on the fact that there's no place for people to go when this is all said and done, but there's going to be some court action that I can almost guarantee is going to happen due to the fact that we're going to be violating some provisions of the Jensen Settlement Agreement as well as the Olmstead provision. April 6th, the federal judge, Donovan Frank, put out a letter to the state saying, I'm watching what's going on, and I'm glad he is, and I'm glad we have some oversight on that. Now we need to come together collectively to make sure that those folks are taken care of. Let me bring one more thing into light, Mr. President. As we look at throwing lifelines out there, Mark and Lana from Champlin own Title Boxing, and they were just given notice that they're $11,000 behind on their rent to their organization, to their place where they did have their business. They're going to have to close the doors. They're going to have to also deal with some issues legally that are sitting out there, that this COVID has taken over, and it's taken over the fact that there are people in our own towns that are hurting and need our help. So I thank you for bringing this issue up, Senator Abler. I thank you for highlighting the fact that Senate File 4200 needs to have some legislative action on it. We need to go forward. Otherwise, there's going to be some folks hurting out there in the state. Thank you, Mr. President, for your time.
Further discussion on the motion, Senator Hayden.
Well, thank you, Mr. Chair, and thank you, Senator Abler. As we listen each and every day to your passionate pleas about what we need to do to get through it, I wanted to ask the question and make sure that I got a sense from Senator Benson or even Senator Rosen about the bill and where it's at and the thoroughness that we need to do to go through the bill to ensure that there is the level of transparency and we know where things are. I would also say that I think that the governor is putting forth very thoughtful ways in which to be able to make sure that we can safely figure out what are the businesses that can be open and how we can do it safely. Over the weekend, we just saw that, in Worthington and just over the border in South Dakota and Wayzata and in Duluth, we've had breakouts, hotspots, still going. It's not calming down. We saw people demonstrating not using the proper social distance protocols amongst each other from the governor's office. I can understand people wanting to get together to try to figure out a way to work their way through it. But we clearly aren't out of the woods yet. We clearly aren't in a position in which we can just kind of just say, you know what, let's just open everything up and expose more people to this deadly virus. So I think that I appreciate, and I know that coming forth, the governor is doing all the things that he can to ensure that we can continue to open up places safely. And I think that we should continue to follow the science. But more than that, I think we should continue to follow the protocols that we have here in the Senate and the rules that we have in the Senate to ensure that the bills that we get through legislatively are gone through the process and that they have been well vetted. We have an opportunity to do it. So, you know, Senator Abeler, I don't know what your intention is. However, if you are moving forward with this, Mr. Chair, I want to make sure we have a roll call for that.
A roll call has been requested. A roll call will be granted. Further discussion on the motion. Senator Kiffmeyer.
Mr. President, I just have a point of order and a question. When a member wishes to speak and is here in the chamber floor, what is the proper way to notify the president that you wish to speak instead of interrupting another member who has the floor and is currently speaking?
Senator Kiffmeyer, members should stand at their desk and get my attention, and I will add their name to the list. Further discussion on the motion. Senator Abeler.
Thank you, Mr. President. And I wish we had more people here on the floor so we could have a more real discussion. These times do not allow that. I think that the concerns that people have do not reflect one party or another. There are towns everywhere that are really challenged by this. And I'm just really nervous, and I'm beginning to despair, and I'm sorry about that. Those protesters at the governor's mansion, some of them are too close together. All I did was see the video. Many were wearing masks. Many were actually distancing themselves pretty well as you got to the edges there, and some were just frankly mad and they didn't care, and I get that. But so how are we going to find our way forward through here? The governor, I told him early in his term, I said, I want to help you succeed, and I'm here to be part of that. That's why I'm telling you this now. I think the path forward includes getting some of these lower level things just out of the question. I have to tell you that the wedding planner in Anoka would be there with one person and two people in 700 square feet. That's really considered safe social distancing. And there's no reason that she couldn't work. She was in the paper last week. And there's a bunch of those kinds. So nobody is put in more risk. They're actually put at less risk of depression, suicide, family failures, and physical abuse, and those are on my mind as well, Mr. President. So, actually, Senator Hayden, I agree with you. This is a horrible way to do this bill. It was an act of a desperate person, desperately trying to make a difference in this great state of ours. And Governor Walz, I'm still here to work with you on this. We're all together on this. There is no opposition to solving this in a safe, constructive way. And so, Mr. President, at the advice of Senator Hayden, I will withdraw my motion.
Senator Abeler withdraws his motion. Remaining under motions and resolutions, Senator Gazelka.
Thank you, Mr. President. Pursuant to Rule 26, I designate the following bills be made for special orders for immediate consideration. Members, the three bills are on your desk.
Members, the first bill up for consideration is number 75 on general orders. It is Senate File 1098. And before Senator Rosen starts, just a reminder to members, if you have an amendment or you would like to provide input or discussion on the bill, please notify the front desk. They will notify me. I will make sure your name is added to the list. Before we go to third reading, I will take an extended pause just to make sure that any members who want to offer amendments have that opportunity to do so. Senate File 1098, Senator Rosen.
Thank you, Mr. President, and thank you, members. Senate File 1098 is the greatly anticipated drug pricing transparency bill, which brings much needed pricing transparency to this convoluted market of prescription drugs. And this will help patients make informed decisions and demand the value from our pharmaceutical companies. And before I begin, Mr. Chair, I do have the A23 amendment.
Senator Rosen offers the A23 amendment. The Secretary will report the amendment.
Senator Rosen moves to amend Senate File Number 1098 as follows. Page 4, line 24, delete. This is the A23 amendment.
To the amendment, Senator Rosen.
Thank you, Mr. President. Members, this is actually just a word change. It was a mistake, and it will follow in line with the rest of the bill. So deleting prescribed and inserting described. So it was just a mistake.
Any discussion on the amendment? Seeing none, all those in favor of the A23 amendment, say aye. Aye. Opposed, say no. We'll take a brief pause to gather the votes in the alternate locations. Receiving a sufficient number of aye votes, the motion prevails and the amendment is adopted. Senator Rosen.
Thank you, Mr. President. Senate File 1098 requires price transparency for 3 categories of drugs. Is this existing drugs, new drugs, and newly acquired drugs? Mr. President, members, this was in Senator Benson's 2019 Omnibus Health and Human Services bill. But it has been greatly modified and changed and agreed upon by all parties. I should say not necessarily agreed upon, but they are neutral from the parties that had problems with it. And this year, it was in 2020, this bill was seen in Judiciary and Finance and then sent to the floor. There's $1.6 million appropriated, and that money has been was appropriated last year in Senator Benson's bill, and that's been sitting at the Department of Health. So there is a zero fiscal note as of today. Just briefly, if I could go through the bill, and to make sure that there is an understanding of what this bill does and doesn't do. So for existing drugs, which is the same as a newly acquired drugs, the reporting begins October 1st of 2021, and the reporting threshold for any drug over $100 for a 30-day supply is a 10% increase in a 12-month period or a 16% increase in a 20-month period for a brand name drug. For generics, it's different, and this was a big compromise. For generics and biosimilars, any price increase of 50% or greater over the previous 12-month period. And the reporting, again, for the existing drugs and newly acquired has to show up at least 60 days after the price increase goes into effect. The name and the price of the drug and the net increase expressed as a percentage, the factors that contributed to the price increase, the name of any generic version of the prescription drug available on the market, the introductory price of a prescription drug when it was approved for marketing by the FDA, and the net yearly increase by calendar year in the price of the prescription drug during the previous 5 years. The direct costs incurred by the manufacturer that are associated with the prescription drug, such as how much to manufacture the drug, to market, or to distribute the drug. The total sales revenue for the prescription drug during the previous 12-month period, the manufacturer's net profit attributable to the prescription drug during the previous 12-month period, the total amount of financial assistance the manufacturer has provided through patient prescription assistance programs, if applicable, any agreement between a manufacturer and another entity contingent upon delay in offering to market a generic version of this drug, the patent expiration date of the prescription drug if it is under patent, and the name and location of the company that manufactured the drug. If a brand name prescription drug, the 10 highest prices paid for the prescription drug during the previous calendar year in any other country other than the United States, and the manufacturer must submit any documentation necessary to support this information reported under this division. So as I said, this applies to the existing and newly acquired. Reporting for new drugs is different, and there has been a lot of compromise in this area. Reporting for brand name drugs has been raised and priced over the current definition of a specialty drug under Medicare Part D, which was raised from $500 to $670. For the generic or biosimilar is priced over the current definition of a specialty drug under Medicare Part D, which is $670, and is not at least 15% lower than the reference brand name drug. The reporting information no later than 60 days after the new drug is listed for sale, the price of the prescription drug, whether the FDA granted the new prescription drug a breakthrough therapy designation or a priority review, the direct costs incurred by the manufacturer that are associated with the prescription drug listed separately, such as to manufacture, to market, and to distribute the drug, the patent expiration date of the drug if it is under patent. The manufacturer may submit documentation necessary to support this information reported under this subdivision. And the research, so the area that is not being reported is the research dollars that were requested in last year's bill. The public posting or the trade secret part of this bill, Subdivision 6, is MDH will review the information submitted by the manufacturer and post this information on a public website in easy, accessible, and understandable format for consumers. And MDH will determine the form and format that is appropriate for the public display. Trade secret protection is under the Minnesota Government Data Practices Act as well as the federal trade secrets laws. And the commissioner shall not post to the department's website any information that is not public data under section 13.02 subdivision 8A or is a trade secret information under section 13.37 subdivision 1 paragraph B or is a trade secret to the federal trade secret laws, which is the Defend Trade Secret Act of 2016. And an area that was highly negotiated and compromised is the manufacturers are allowed to identify submitted data considered trade secret and submit a rationale in writing to the Department of Health. And if MDH disagrees, they will notify the manufacturer of this decision 30 days before posting. As I said, this is new language that has been worked on extensively through the stakeholders this year. MDH will report the nature of any data withheld and the reasons for withholding the information from public disclosure. The commissioner is to consult with a private entity or consortium using the form and format and establish a standard format of reporting for this information. There is enforcement and penalties, and the manufacturers, if they fail to comply, will have to pay $10,000 per day for failure to submit, failure to provide correct information, or required information, I should say, or providing inaccurate or incomplete information. And these fines are deposited in the Healthcare Access Fund. And there is a report, legislative report, that begins on January 15th of 2022. And the bill is effective on August 1st, 2020, with reporting from the drug companies beginning on October 1st of 2021, a year and a half from now. Why this bill is important is because drug manufacturers are not subject to the same price transparency that hospitals, providers, and health plans are. And drug costs are now representing 23 cents of every dollar spent on health care, which is more than inpatient hospital costs. The latest round of price increase happened this past January, and prices increased on more than 200 prescription drugs. And remember, members and Mr. President, only if the price is increased by 10% in a one-year period or 16% in a two-year period do they have to go through the transparency bill. Just to give you a couple examples of some of the horrific price increases we have seen and witnessed, and our consumers have seen and witnessed, is naloxone. It's $4,100 a dose, and that's, of course, used to reverse opioid overdoses. And one manufacturer hiked the price by 600% over the last 4 years, from $575 to $4,100 a dose. And Mr. President, members, I'm going to have a tough time with some of these words, so don't laugh at me. Bedazerone is over $9,000 annually, which treats multiple sclerosis. And it was brought to market in 1997, listed for $10,000 annually, and now is listed over $90,000 annually. Daraprim, which is $45,000 monthly, is an aid treatment given to patients, also to treat other types of infections and transplants. The list price for 1 month is $45,000. And the drug first made headlines in 2015 when Martin Shkreli acquired the drug and immediately increased the price from $13.50 per pill to over $750 per pill. EpiPen stops allergic reactions. Mylan raised the price of a 2-pack of EpiPens from $100 to more than $600 in 2016. Sovaldi is $84,000 for a course of a treatment, and this is used to treat hepatitis C. The patients take Sovaldi for 12 weeks, and the list price for 1 month runs at $28,000 or $1,000 per tablet. Humira, used for rheumatoid and psoriatic arthritis, is $65,500 annually. Acthar is used to treat lupus, rheumatoid arthritis, multiple sclerosis. Back in 2001, when Sanofi first manufactured the drug, the list price for 1 vial ran at about $40. 17 years and 1 manufacturer later, the list price for 1 vial of Acthar is now $39,864, $40,000 for 1 vial. Tipsova is $27,421 monthly, and this treats an acute form of leukemia. The list price, and this is just for 1 month supply, which makes it completely unaffordable for most people. So what is not in this bill, members? And what has changed from last year? The thresholds were raised from $40 to $100 for reporting of a 30-day supply on a drug. And this was a great compromise and makes it more in line with some of the other states that are moving in this direction. The reporting of the new drug, which is priced under the Medicare Part D of $670, that's a change from last year. Research dollars are not to be reported in this bill, nor political donations, and about 20 other issues were eliminated from this bill in a compromise. Public domain language is gone, and the compromise language for reporting requirements is the 30-day notification from the Department of Health and the higher threshold for the generics. There are false accusations running out there that there is a privately negotiated reimbursement rates need to be disclosed. They are not required to be disclosed. And there are no price control measures in this bill, like a price review board or affordability commission. And remember, I'm going to say it again, members, only they can still raise their prices by up to 10% and not have to report. It's when you hit over that 10% in a 1 month or a 1 year period, do they have to report. The list of supporters, this is going to take me a while, and you will be amazed at the amount of bipartisanship and different groups that have joined and worked very hard to make this bill a reality. ARP, the Alliance of Hospitals and Clinics, Patients for Affordable Drugs, the ALS Association, Clearway, Minnesota, National Multiple Sclerosis Society, Association of Minnesota Counties, League of Minnesota Cities, Minnesota AFL-CIO, the Association of Health Underwriters and County Health Plans, the Minnesota Medical Association, the Minnesota Nurses Association, Minnesota Association of Community Health Centers, Labor's International Union of North America, SEIU Healthcare Minnesota, Communication Workers and American Minnesota State Council, Minnesota Farmers Union, Education Minnesota, Minnesota Business Partnership, Minnesota Council of Health Plans, Blue Cross and Blue Shield, Health Partners, Hennepin Health, Medica, Preferred One, Sanford Health Plan, UCare, America's Health Insurance Plans. There are 40 other states that have introduced bills of this sort last year. We have Texas, Nevada, Maine, Oregon, Connecticut, and California, who have all implemented a drug pricing transparency bill. It's been tightly crafted, and there's many that I would like to thank for their participation through the drug companies, the generics, through Medical Alley, through the health plans. There has been a lot of hands on this bill. It's been tightly crafted. And as I said, there is consistent language with other states that are already doing this reporting. And members, before I turn it over to questions, I'd just like to make reference to an article from the Financial Times that came out March 19th, just last week. And this is exactly what is happening. And fortunately, they got caught. They got busted. So they lowered the price. But the only U.S. drug maker that makes the potential treatment for the coronavirus raised their price by 100% in January because they knew of the havoc being caused in China. And once they basically got caught, they decided not to raise the price. So this is the same company that was admitted price fixing in a case in Pennsylvania and paid $3 million in fines. And I think that's deplorable, these kind of actions, when you know something is in great need and you raise the price. So again, members, this bill is something that is greatly overdue. It is a necessity for Minnesotans. Healthcare costs are still our #1 priority in Minnesotans' minds, and everywhere, everyone is sharing this concern. Even with this COVID issue, how are they going to pay for their drugs and their healthcare costs? And from the person suffering from the chronic condition who cannot fathom how they will pay for their ever-increasing price of a life-saving drug, to the taxpayer who is paying for these high-priced drugs through the state and federal taxes that fund our public programs such as Medicaid, Medicare, and Minnesota Care and other state initiatives. And basically, individuals have no bargaining power to receive a lower price. The consumer deserves to know what the real costs are, and it's hard to understand why they are continual price increases on drugs that have been on the market for such a long time. So if there is justification for a price increase of 10% or more, the consumer deserves the transparency of the price increase, and basically the pharmaceutical perhaps may have a very good reason for this increase and now needs to tell the consumer and all public figures. So with that, Mr. Chair and members, I will stand for questions.
Discussion on Senate File 1098 as amended. I have Senator Marty, who will be followed by Senator Ralph. Senator Marty.
Thank you, Mr. President and members. This bill, as Senator Rosen mentioned, is designed to start trying to do something about the people being ripped off by high drug prices. And I think there are very few Minnesotans who don't understand what's happening. And I, like all those other groups, I think all of us here are happy to support the bill because I think it's important that people know. But the problem with the bill and where we are right now is that this bill, if a drug company is jacking up their prices, if they're ripping people off, they're going to have to report, which is good. But they're still allowed to rip us off. It doesn't change anything there. It simply says you cannot rip us off anymore without telling us you're doing so. And I frankly think most of the people who are paying the outrageous prices know they're getting taken advantage of. I mean, that's why we had the huge fight over the insulin bill recently. It's a very important thing. So I want to say that the transparency is important, but it alone does not do anything to change it. It simply discloses it. And with that in mind, Mr. President, I have the A29 amendment at the desk.
Senator Marty offers the A29 amendment. The Secretary will report the amendment.
Senator Marty moves to amend Senate File number 1098 as follows. Page 1 after line 6, insert. This is the A29 amendment. To the amendment, Senator Marty.
And Mr. President, This actually comes from, it's legislation Senator Matt Klein introduced last year and has been working on. The House has moved the bill further forward, and so this actually takes the House language, which had gone through, I believe, all the committees now and was on the floor. This is one of the top recommendations of the Attorney General's Prescription Drug Pricing Task Force. And I think the thing it does, it basically says, it sets in on Section 5 on page 6 of the amendment, you can see it's a prohibition against charging unconscionable prices for prescription drugs. You cannot, we'd be disclosing them through the bill, and then we would be saying that if they're above, if they're unconscionable pricing, which they define here, if they're unconscionable price, which means it's not reasonably justified by the actual cost of inventing, producing, selling, distributing the essential prescription drug, and any actual cost of appropriate expansion of access to the drug to promote public health. So in other words, all the possible things you may have for prices, including the inventing and all the research and work behind that, which is often funded by federal government. But all those prices, you're allowed to count for that. But if the drug prices are unconscionable, the Attorney General would have the power to go after them. And Senator Rosen pointed out one drug, I can't remember which one, she said was initially $1,000 a course, treatment now $90,000. I mean, I think we've all seen these drugs that were, Martin Shkreli made national news a couple of years ago when he jacked up the prices of 7,000%. When we see that kind of thing happening, that's why we want the disclosure, but we don't just want them to disclose it and then say, you disclosed it, so now you can rip us off. We're saying, no, if you're charging unconscionable prices, we believe it's appropriate that we can go after this. And I think this is one of the top recommendations of the Attorney General's task force. It'll give us a reason. This ties in with this whole issue, the disclosure and enforcement of these laws is very important. It's a huge cost. I'm not going to second all the things that Senator Rosen said, because I think we all recognize it, we understand that. And I think it's time to say, you know, disclosure is important, but we're going to do something. We're going to disclose it and make sure you stop charging us rip-off prices for this. I'd be happy to stand for questions on this, and Mr. President, request a roll call.
A roll call has been requested. A roll call will be granted. A discussion on the amendment. Senator Rosen.
Thank you, Mr. President and members. And thank you, Senator Marty, for apprising me on this amendment that you were going to bring forward, affectionately known as the gag rule. I have to unfortunately oppose this amendment, even though I believe that going forward, this is an amendment, a bill, an issue that needs to bring all stakeholders to the table. And that's why we have Senate File 1098 in front of us today, members, is because all the stakeholders were at the table. And as I said, whether they are in agreement or they're standing down or neutral on the bill, the stakeholders that were part of this discussion were around the table discussing it. And so with great merit, this amendment has, and I believe the discussion needs to continue. This will change the dynamics of this bill, and we perhaps will lose the agreement that we have from all the stakeholders by moving it forward. But it should get the attention. So please, Senator Marty, I would ask you kindly to bring all those stakeholders forward and see if we can move this bill in another fashion. So members, please vote no on this amendment.
Members, we're on the A29 amendment. Further discussion on the amendment? Senator Marty.
Mr. President, Senator Rosen, I understand your comments. Again, I wish we could get these bills heard. I know Senator Champion had a wonderful bill to try and stop the way the pharmaceutical industry is trying to extend their patents by dealing with the generic folks and they do every trick in the book to try and extend their patent life so they can continue jacking up prices. We've had a number of bills on this kind of thing. I think this bill is a good one. When you talk about all the stakeholders, I think the only stakeholders I picture having any objection to this coming from the pharmaceutical manufacturers. I don't think you're going to find business community folks or labor folks or patients or doctors and nurses or hospitals or AARP or any consumer group or disability advocacy group or anybody having any problem with saying you can't charge unconscionable prices for drugs. I think it makes good sense, and I urge your support.
Further discussion on the A29 amendment. Senator Limmer.
Thank you, Mr. President. Would the author of the amendment yield?
Senator Marty will yield. Senator Limmer.
Thank you, Mr. President. Senator Marty, if I could bring your attention to page 6, line 28. There is a purpose given in definition in this legislation. We usually don't do that. Another word for that is a finding. The legislature finds some circumstance to justify a particular statute. Why are we putting this purpose language in this bill when it's the tradition of the Minnesota state government not to have purpose or finding established in any statute?
Senator Marty.
Mr. President, Senator Limmer, as you know, there are times when we do this, and they're often in a case like this, it's because there have been cases where folks have tried, if you're dealing with something that there may be controversy with and big dollars amount, we're talking billions of dollars of drug company pricing things, they will sometimes go to court and so on, and this is very clearly saying what our public purpose is, why it's appropriate that the state steps in and takes action like this, and I think it will help in cases where the Attorney General would be forced to take action against a drug company for ripping us off, to have it spelled out why in the statute. I think it would give us a much better chance of them winning that lawsuit on those prices.
Further discussion, Senator Limmer.
Mr. President, thank you. Also on lines 8.29, we have, or actually page 9.1, we're giving direction to the Attorney General's office to confer with a drug manufacturer or distributor. Why does the legislature have to give specific permission to an Attorney General? I would think an Attorney General would be able to do that on their own without legislation.
Senator Limmer, are you asking Senator Marty to yield again to that?
Yes, Mr. President.
Senator Marty will yield. Senator Marty.
Mr. President, Senator Limmer, this gives the Attorney General, it actually directs them to talk with them, to give the drug manufacturer, wholesale distributor, the opportunity to present any justification for the price of the essential prescription drug. If they think they are not price gouging, if they think it is fair price, not an unconscionable price, they would have their chance to discuss it and avoid going to court if they can persuade the Attorney General that, or at least show that they have a good cause for the high prices. I don't think they have the good cause, but this simply gives them the chance to meet with the Attorney General and present their evidence on why they don't think they should go forward.
Well, Mr.
Further
President,
discussion, Senator Limmer.
another question to the author of the amendment.
Senator
Mr.
Marty
President,
will continue to yield. Senator Limmer.
Senator Marty, I guess I'm a bit confused. Further down in the bill, 9.9, it allows a private right of action by an individual citizen. Does that individual citizen then become dependent on whether or not the Attorney General will prosecute this case? Or will the private right of action allow an individual citizen to go forward with this particular cause of action himself? And the reason I'm raising this question is it almost negates the opportunity for the Attorney General to have some direction from the legislature. Again, the Attorney General needs no permission from the legislature. It's a separate branch of government. And it doesn't need our permission from the legislature to go talk to manufacturers. And depending on what the answer is from the manufacturer, does that negate the possibility of going to court or not? I am rather confused by the role of the Attorney General in this case, as well as the role of the legislature to give the Attorney General direction.
Senator Marty.
Mr. President, Senator Limmer, the legislature and Attorney General is obviously different branches of government. The whole point here is we want to make sure the Attorney General is dealing with the drug companies, and if they can avoid a lawsuit, they can discuss it all, and they can have them provide any evidence they want that they need. The Attorney General is not, we're not being unfair to the Attorney General here. The Attorney General's task force actually recommended this kind of provision, and so this is simply language to make sure that they discuss it thoroughly with the drug companies and so on. I think that's an appropriate approach. I think it's a very reasonable approach here. In other words, if the drug company is coming in and charging $40,000 for a drug that was developed by government researchers and they were once selling it for a lower price, much lower price, and they're making unconscionable profits off the drug, the Attorney General can go to them and say, look, this looks unconscionable to me, and we're actually giving the drug companies an extra chance to talk it over and maybe avoid a lawsuit if so. So, Mr. President, Senator Limmer, I think this is very reasonable, very responsible, and I don't think the Attorney General will object to this. It was, again, this idea came out of their prescription drug task force as a reasonable step forward, as one of the most important steps forward in stopping price gouging.
Further discussion on the amendment, Senator Limmer.
Thank you, Mr. President. One other question that I had. Senator Marty, could you tell me what the definition of unconscionable price is? I wish some of this language, quite honestly, would have been directed to the Judiciary Committee where we could have ironed out a lot of these questions. Some of these are rather complex and certainly difficult for the Senate to vote on if there's not proper definition.
Senator Marty will yield. Senator Marty.
Mr. President, yes, Senator Limmer. First, unconscionable price would be a price that's not reasonably justified by the actual cost of inventing, producing, selling, and distributing the drug, and any actual cost of appropriate expansion and marketing of it. If they need to get more out to more people and they have to charge more for that, those would all be things that, if it's not those things, if it's beyond that, it's unconscionable. In other words, they can make a profit. They can make a great return on their investment for their research, everything else, all their expenses, but if it's beyond that, it's unconscionable. And I think that's what we're seeing here. And I think the public, frankly, knows what's unconscionable about it. They see what's happening to them. I think everybody here, I think every one of the groups except the drug companies would agree that these are unconscionable prices. In political worlds, both parties say they hate the unconscionable prices. This is saying, let's do something about it.
Mr. President.
Senator Limmer.
One further question for the author to yield.
Senator Marty will continue to yield. Senator Limmer.
Thank you, Mr. President. Senator Marty, I heard the word in your definition regarding unconscionable price as a reasonably justified action by the manufacturer. The question is what's reasonable? Usually the word reasonable is something that we usually try to avoid as we're defining legislation and defining causes of action, at least in our Judiciary Committee. We try to get very specific because, after all, if you're going to sue someone, You want to make sure that they really did something that's wrong. But you even mentioned reasonable profit. We don't want to deny a company reasonable profit. Well, whose definition are we going to follow under reasonable profit? Is that going to be defined by the courts now? Is that going to be defined by the legislature? What's reasonable? You know, I came into this debate not really knowing how I was going to vote on this particular bill. It kind of goes one direction that I love and another direction that I get a little cautious on, especially when government is dictating terms to any business that you can make a reasonable profit. We're just not going to tell you what that reasonable profit is. We're not going to tell you when you step over the line. Another word in page 8, line 12 is that it has to be reasonably justified by the actual cost of, I suppose, the inventing, producing, selling, and distributing the drug that we're talking about. But what's reasonably justified? What's a reasonable price? I find that, you know, as a chairman of the Judiciary Committee, we have these debates all the time. We could have had this debate if it would have been added to the bill during the time that Senator Rosen put it through the trail of going through a variety of committees, including the Judiciary Committee. Now it springs up on the floor with a limited number of members here, and we're trying to determine what the word reasonable is. What's a reasonable profit? What's a reasonable justified expense? Some of these drugs take, I believe, years and years to develop. They take trials, and I'm not justifying their price. I'm just trying to determine what's reasonable in the eyes of, let's say, a jury who may want to listen to this future debate in a courtroom somewhere. I think that's vitally important for us to consider, and I quite honestly think that the word reasonable in defining unconscionable price is going to be very hard to define at this moment.
Senator Frentz.
Thank you, Mr. President. And thank you, Senator Limmer. Glad to report that the word reasonable is determined by Minnesotans on juries successfully in civil cases and regulatory cases. And in the case of an unconscionable price, the answer to your question is it's for 6 or 12 members of the Minnesota public sitting in a jury box to determine what is and what is not reasonable. And if they say it's unreasonable, it's unreasonable. We use that in civil litigation and negligence cases, and it works great. I'd also say that as to the question of the amendment springing up, I'm glad to acknowledge Senator Marty providing information about this amendment to Senator Rosen. Thank you very much, Mr. President.
Any further discussion on the A29 amendment? Senator Benson is next on the list, followed by Senator Rosen. Senator Benson.
Thank you, Mr. President. And Senator Marty, if you could answer a question as to why this would be retroactive to 2014.
Senator Marty will yield. Senator Marty.
Mr. President, Senator Benson, this is to allow us to go after drugs where they've been ripping people off in the past as well. Unconscionable is unconscionable. We ought to be going after people who are ripping off our taxpayers, ripping off our individual constituents, ripping off all of us.
So, Mr. President.
Senator Benson.
And Senator Marty, then why not the year 2000 or the year 1968? Why don't we allow people to go back as far as they want to? We generally make laws that are prospective. And so I think it is a terrible idea to set a precedent where if you've done business in Minnesota, we can just decide at some point in time that we're going to go back and take a look. So that's one significant problem with the amendment as presented. A bigger problem This is aimed at pharmaceuticals. But let's be clear, if you're anywhere in any healthcare supply chain, a medical practice, a care system, a medical device manufacturer, this is going to give a path for a jury of people to decide you've made too much money. Right now, people are very happy to take a pound of flesh out of pharma. I totally get that. But there are a lot of other people in the medical system who make a margin. And there have been many discussions on the floor about unconscionable margins. And once we start letting politicians, policymakers, and juries decide what's unconscionable, Katie, bar the door. If you're an MD in private practice, what's too much to charge? If you're a hospital system that makes 1.2% margin, is that too much? Because what they'll present to the jury is how big your reserve is. So, there are many reasons to oppose this amendment. But the primary one should be that it's going to be applied far beyond the target audience here.
Further discussion on the A29 amendment, Senator Rosen.
Thank you, Mr. Chair, members. And again, members, I'm going to ask for a no vote on this amendment. And even though the idea is worthy, obviously, through the discussion with Senator Limmer, Senator Benson, whose committees that obviously should have been through, and to be honest, Senator Marty offering an amendment with fiscal ramifications, this needs to be in front of the Finance Committee, where you are an amendment or a member of also. So this is a very delicate bill, Senate File 1098, with agreement from everyone. And to put a bill like this, an amendment on top of Senate File 1098, would cause great havoc with the agreement that has been negotiated. And I look forward to the day that this bill, your amendment, Senator Marty, comes before Senator Limmer's committee, just like Senate File 1098 did, and goes before Senator Benson's committee, just like Senate File 1098 did, and then comes before the Finance, where we can find the appropriations for the Attorney General of $427,000 and $46,000 to the Commissioner of DHS from the General Fund. So with that, again, members, please vote no on this amendment.
Members, we're on the A29 amendment. A roll call has been requested and will be granted. Seeing no further discussion on the A29 amendment, the Secretary will take the roll. Again, a reminder to the members in the chamber, after your vote, please exit the chamber through the front door. And I will call on members in the alternate locations. They can come in through the side doors, vote at your desk, and then exit through the front door. Members in the retiring room, please come to the chamber and vote. Okay. Members in the East Gallery can make your way down to the chamber. While they're coming down, members in the President's office, please come to the chamber and vote. Enter through the side doors, exit through the front door. Again, members, please enter through the side doors and exit through the front door. Members in Capitol Room 303, please make your way down to the chamber. And while they're coming down, members in Capitol Room 237, please come to the chamber to vote. Enter through the side doors, exit through the front door. Members in Capitol Room 237, please make your way to the chamber and vote. Members in Capitol Room 323 are making their way to the chamber to vote. Members in Capitol 206. room 206. Please come to the chamber through the side doors and exit through the front door. I will now call on Senator Kent to report the votes for the members who are voting remotely. Senator Kent.
Thank you, Mr. President. I report an aye for Senator Bigham.
Senator Bigham votes aye. Senator Kent.
I report an aye for Senator Carlson.
Senator Carlson votes aye. Senator Kent.
I report an aye for Senator Clausen.
Senator Clausen votes aye. Senator Kent.
I report an aye for Senator Dietzick.
Senator Dietzick votes aye. Senator Kent.
I report an aye for Senator Eaton.
Senator Eaton votes aye. Senator Kent.
I report an aye for Senator Isaacson.
Senator Isaacson votes aye. Senator Kent.
I report an aye for Senator Klein.
Senator Klein votes aye. Senator Kent.
I report an aye for Senator Lane.
Senator Lane votes aye. Senator Kent.
I report an aye for Senator Latz.
Senator Latz votes aye. Senator Kent.
I report an aye for Senator Newton.
Senator Newton votes aye. Senator Kent.
I report an aye for Senator Pappas.
Senator Pappas votes aye. Senator Kent.
I report an aye for Senator Rest.
Senator Rest votes aye. Senator Kent.
I report an aye for Senator Sparks.
Senator Sparks votes aye. Senator Kent.
I report an aye for Senator Torres Ray.
Senator Torres Ray votes aye. Senator Kent.
I report an aye for Senator Wickland.
Senator Wickland votes aye. I will now call on Senator Gazelka to report the members who are voting remotely. Senator Gazelka.
Senator Bruce Anderson votes no.
Senator Anderson B. votes no. Senator Gazelka.
Senator Dames votes no.
Senator Dames votes no. Senator Gazelka.
Senator Eichhorn votes no.
Senator Eichhorn votes no. Senator Gazelka.
Senator Hall votes no.
Senator Hall votes no. Senator Gazelka.
Senator Housley votes no.
Senator Housley votes no. Senator Gazelka.
Senator Ingebretson votes no.
Senator Ingebretson votes no. Senator Gazelka.
Senator Johnson votes no.
Senator Johnson votes no. Senator Gazelka.
Senator Lang votes no.
Senator Lang votes no. Senator Gazelka.
Senator Newman votes no.
Senator Newman votes no. Senator Gazelka.
Senator Senjum votes no.
Senator Senjum votes no. Senator Gazelka.
Senator Weber votes no.
Senator Weber votes no. Senator Gazelka.
Senator Westrom votes no.
Senator Westrom votes no. All members having voted who have the desire to vote, the secretary will close the roll. There being 32 ayes and 33 nays, the motion does not prevail. The amendment is not adopted. Members, we are back on the underlying bill, Senate File 1098, as amended. And next on my list to speak on the bill was Senator Ralph. We'll give Senator Ralph a moment to come in the chamber. And then at this point in time, I do not have anyone else on the list to speak. So if there's anyone in the chamber or anyone in the alternate locations who would like to speak, please let the front desk know and we will get you added to the list. Senator Ralph.
Thank you, Mr. President. First of all, I want to acknowledge the absolute Herculean effort that Senator Rosen has put into bringing this bill forward. This is a very contentious issue. We are talking about a very difficult subject, that is the lives of people. And I want to just make it clear that there is an issue here that we need to address. However, I have some deep reservations and deep concerns about what we are doing, both specific in the provisions of the bill and the precedent that it may set. I'd like to talk in general first. This bill raises issues that were, I think, quite clearly brought forward in the discussion of the amendment that just passed. We are dealing with a situation that involves subjective judgments. And any time we try and formulate policy based on a subjective judgment, it is fraught with danger, because subjective judgment is what happens to be in the mind of the person who is making that judgment, and that can change day to day. And before we invoke the heavy hand of government, we have to be very concerned about several things. One of them is that the people who we are seeking to prohibit from action fully understand the nature of the charge against them. And that's what this is, make no mistake. So I want to be very clear that the precedents that we may be setting here, while do have some historical background, we do regulate businesses. Utilities are a perfect example. But we are very careful to provide a clear framework within which that regulation takes place. To the specifics, I am very concerned, and I have spoken with Senator Rosen and hope the discussion can continue about the amount of data, the type of data, and the various questions that drug manufacturers may be required to answer. And we can talk about trade secrets, and I'll speak to that in a moment. But we are starting to ask these businesses about the very fundamental way they do business. Now, at first blush, that may seem to be a good thing. Gee, business should be transparent. However, for those of us who have been in business, my marketing plan for my business is something I should not have to reveal to the public for several obvious reasons. One of them is competition. And while competition is good, it should be on a level playing field. So I'm very concerned about that. The other specific concern I have is with the, again, centered around the trade secret area. And unfortunately, what will happen in this bill, I am very concerned about. And I'm very glad that we at least took some steps to try and provide the manufacturer, and I'm using that in the small m, not the large m, because this bill is going to be precedent in the future. I'm very glad that at least we put some provision in the bill to give that manufacturer some say as to whether what they believe are trade secrets are going to be made public. Stop and think about it for a moment. That decision is being made by the commissioner, an unelected official, probably without a lot of legal training, and I am presuming they will seek legal advice on this, but the ultimate decision is with the commissioner. And that may be, again, subjective. So I am glad at least that we are giving the manufacturer the opportunity to say, hold on, stop, wait a minute. My concern is about the way we're doing it. This will invite major lawsuits. If there is any indication that those things that they are about to post on the website are trade secrets. And make no mistake, this will be expensive for both the drug manufacturer, and I will say that specifically, but more importantly, the taxpayers of Minnesota. I would like to see, if possible, a much more user-friendly from both the taxpayer and the manufacturer's standpoint process, which would involve administrative reviews that then can be appealed, because in many cases those issues will be decided at that administrative level. And I would like to see us look forward to that as we go forward in the future. I will be voting for this bill because I do think it is important to start the conversation about what's been going on in the drug industry for many, many, many years. And I believe that this is a good way to do it. And again, I have to compliment Senator Rosen on how she has dealt with the terribly conflicting and tugging interests and come to what I believe is about as good a compromise as we could come to. And so I will be voting forward, and thank you.
Further discussion on Senate File 1098 as amended. Senator Marty.
Thank you, Mr. President. I want to say that in the last amendment, there were lots of people asking for bills to go to Judiciary Committee and Health and Human Services Committee. And I want to say I want to see these bills go to those committees, but they're not getting heard. And I can mention Senator Wickland, Senator Little, Senator Franzen, Senator virtually all the members of the Health and Human Services Committee have offered prescription drug pricing bills, and they're not getting heard. And again, as far as them going through Judiciary Committee and so on, we had to settle for one that went through the House Judiciary Committee because that last language did. But I think that I'm trying here with an amendment that I know Senator Rosen may or may not support, but she doesn't want it on this bill. But this is a pure transparency amendment I want to offer, and I will ask for A22 amendment be offered.
Senator Marty offers the A22 amendment. The Secretary will report the amendment.
Senator Marty moves to amend Senate File number 1098 as follows. Page 7 after line 3, insert. This is the A22 amendment.
To the amendment, Senator Marty.
Thank you, Mr. President and members. This one is one that's to help some small businesses, pharmacies, and it's purely allowing for more transparency. Last year, the legislature appropriately put a ban on a lot of the gag rule against pharmacists, where they can't talk with their customers about a lot of things related to pricing and so on. But we have a gap in that law that this would close, and you can see the language in the A22 amendment. And that is that pharmacy benefit manufacturers, where we put some legislation in to try and rein in their outrageous thing. There are two folks who are behind all the ripping off of public in terms of prescription drug prices. One is the manufacturers. The other one's the pharmacy benefit managers, whose only purpose is supposed to be to help people get better prices on their drugs, but in the end they've found a way to make more money off of them and without having any obligation to be responsible and responsive to their customers. In other words, because of this highly secret, non-transparent system, they can get away with a lot. And the issue here is one that how they treat independent pharmacies and pharmacies that they don't control. Last year in the metro area alone, there were 45 pharmacies that closed. 45 different pharmacies just in the metro area. There aren't that many pharmacies left in Minnesota, and we're losing them. This amendment came to me from a constituent, and I know Senator Bigham asked if I'd push this amendment because she has small pharmacy as well who's being hit by this. But the pharmacist in the case that I talked to, one of the days when I was talking to him, he said, just this morning I had a woman come in, pick up a drug. I filled the prescription for her, but I lost over $200 on that price, on that drug sale. Not counting his dispensing fees or anything, but just his cost of purchasing the drug was $200 more than he was reimbursed by everything from the co-payment to the main payment from the pharmacy benefit manager. He was going to lose $200 by selling a drug that he has to sell because he has contracts with the health plans and so on. But our gag rule prohibits that pharmacist from telling the patient, the customer, that you're buying this thing here and I'm selling it to you, but I just want you to know I'm losing $200 by selling you this, plus my dispensing fee, so I might be losing $220 on this. And I'll sell it to you, but that's an unfair system, and these things called pharmacy benefit manufacturers are sticking it to us. And they're sticking it to a lot of pharmacies. They want to drive everybody else out so they can have their mail-order pharmacies control the whole market. That's why we lost 45 pharmacies in the metro area last year. Those of you in greater Minnesota know the problem's even worse there. We don't have that many of these left. So all this bill would do, the only thing this would do, would be expand our gag clause prohibition to say that the pharmacy benefit manager and others cannot prohibit the pharmacist from discussing the total cost of the pharmacy's acquisition cost of the drug and the amount they are being reimbursed by the PBM or the health carrier for the drug. So in the case of this pharmacist getting a drug has to buy it for $400, can only sell it for $200, for the $20 copay or whatever, plus the money coming from the pharmacy benefit manager. The PBM pays them, along with every other payment they get, $200 for a $400 medication. You can tell that to the patient. Tell them, I have to fill this, but you ought to know about it, and maybe you should talk to the health plan about it. It also allows them to talk to the health plan about it. This is pure transparency. It's something this Senate has said last year we want to do is get rid of the gag rule. We missed a part of it, and I urge your support for this. I ask for a roll call.
A roll call has been requested. A roll call will be granted to the amendment. Senator Rosen.
Thank you, Mr. President, and thank you, members. And Senator Marty, even though, well, this is the amendment that you apprised me of before. It was the previous amendment that I did not know about. So I am aware of this information and this amendment that you were going to bring forward. Again, members, even though this sounds like it is something that needs to be addressed in this bill, it should not be in this bill because the A22 is more for the PBM adjustment and not for drug price transparency. And I want to make that very clear. This is 62W.11, and the drug pricing is 62, section 62. So, members, again, this, and as you know, Senator Marty, you've been through many difficult bills where you have sat through hours of negotiation with the stakeholders, and your commitment to those stakeholders to make sure that you get a good, clean, negotiated bill off the floor with no surprises. And I'm hoping that you can respect that commitment that I made to those stakeholders to get the very product, Senate File 1098, off this floor with no amendments that are going to take us to perhaps a conference committee, which we, in the times that we are dealing with right now, do not have the bandwidth to hold. So my intent is to get a really solid Senate File 1098 off the floor. And even though this gag clause prohibition is a great idea, I do believe it belongs in a separate committee with a full vetting and a separate bill, and something that we can work on next year. So members, I do oppose this amendment, the 822 amendment, and I respectfully ask for a no vote on this amendment.
Further discussion on the amendment. Senator Benson.
Mr. President, I rise to a point of order that this amendment is not germane under Rule 35. It pertains to a substantially different subject as identified. It is a completely different section of law, and it applies to a completely separate group of individuals. These are PBMs, not the manufacturers, and while they are linked through the pharmaceutical supply chain, were we to open this up, there is a very long path of pharmaceutical supply chain, and so in keeping with the scope that Senator Rosen has brought to this floor, I would ask for a ruling that this is not a germane amendment.
Senator Benson raises a point of order under Rule 35.1 that the amendment is not germane. Advice to the President. Senator Marty.
Mr. President, this bill deals with pharmaceutical price transparency. That's the way it's been described. Every time we've talked about it, all this amendment does is increase price transparency. These pharmacies are not able to disclose the prices they're paying. They can't tell anybody that. So all this does is expand transparency. I urge you to rule it germane.
Mr. President, advice?
Further advice, Senator Benson.
Mr. President, if we are going to open this up to the entire pharmaceutical supply chain, then amendments as to the germaneness of hospital pharmaceutical pricing transparency would be germane. The profits of individual pharmacies would be germane. That would take us well beyond the intended subject, which is the manufacturer price transparency disclosure. And perhaps we have been careless in calling this out as manufacturers pharmaceutical price transparency. We have not included wholesalers. We have not included PBMs. We have not included pharmacies. We have not included the companies that deliver mail order pharmaceuticals to our homes. We have not included hospitals. We have certainly not included the Department of Human Services and their preferred drug list, in which we are not allowed to see any of the rebates that they receive except in aggregate. So, Mr. President, if the argument is pharmaceutical supply chain, we would be opening up to a very broad subject. I would argue that this is not germane because it applies to a substantially different subject.
Further advice, Senator Franzen.
Thank you, Mr. President. I'm very disturbed of what I'm hearing on the Senate floor right now about the process of how our bills are going to come to fruition and starting today. If the assumption is that we're going to have a bill that can't get any amendments because they're not convenient and we're going to call them ungermane, that's one thing. But the other thing is that we're not going to even be open for conference committees. Last time I checked, this is the Senate floor where we debate bills, we work on amendments, and if they do get amended and the House, the other body has a different bill, that we merge them and we go to conference committee. So that's a separate issue, but very disturbing that we are here taking time to serve our constituents and our state in a very, very tough situation, but that our rules in the Senate floor are changed because something is not convenient. None of this is convenient, Mr. President, and I urge that this talk about germaneness be withdrawn because PBMs, pharmacy benefit managers by name, are completely related to price transparency of pharmaceuticals. Thank you, Mr. President.
And members, just to be clear, we are still operating under the rules of the Senate. Those rules have not changed, except for the changes that were voted on by the chamber. Any other discussion on the point of order? I rule that the point of order is well taken and the amendment is not germane. Further discussion on the bill. Senator Marty.
Mr. President, I want to challenge the ruling of the chair and ask for a roll call.
Senator Marty is challenging the ruling of the president. Upon appeal, so he's appealing the ruling of the president. An appeal is decided by a majority vote of those present and voting. Upon an appeal from the decision of the president, the question is, shall the decision of the president be the judgment of the Senate? A green vote is in favor of the judgment of the president, and a red vote is against the judgment of the president. So this is a roll call vote. The secretary will take the roll, and after you vote, please exit the chamber through the front door, and I will call on the rooms individually to come to the chamber and vote. Members in the retiring room, please come to the chamber and vote. Members in the East Gallery, you can make your way down to the chamber. While they're making their way down, members in the President's office, please come to the chamber and vote. Members in room 303, please make your way to the chamber. And while they're on their way down, members in Capitol Room 237, please make your way to the chamber and vote. Members in Capitol Room 323, please make your way down to the chamber. And while they're heading down, members in room 206, please come to the chamber to vote. Enter through the side door, exit through the front door. 323 and 206. I will now call on Senator Kent to report the votes of the members who are voting remotely. Senator Kent.
Thank you, Mr. President. Senator Bigham votes no.
Senator Bigham votes no. Senator Kent.
Senator Carlson votes no.
Senator Carlson votes no. Senator Kent.
I report a no for Senator Clausen.
Senator Clausen votes no. Senator Kent.
I report a no for Senator Dietzick.
Senator Dietzick votes no. Senator Kent.
I report a no for Senator Eaton.
Senator Eaton votes no. Senator Kent.
I report a no for Senator Isaacson.
Senator Isaacson votes no. Senator Kent.
I report a no for Senator Klein.
Senator Klein votes no. Senator Kent.
I report a no for Senator Lane.
Senator Lane votes no. Senator Kent.
I report a no for Senator Latz.
Senator Latz votes no. Senator Kent.
I report a no for Senator Newton.
Senator Newton votes no. Senator Kent.
I report a no for Senator Pappas.
Senator Pappas votes no. Senator Kent.
I report a no for Senator Rest.
Senator Rest votes no. Senator Kent.
I report a no for Senator Sparks.
Senator Sparks votes no. Senator Kent.
I report a no for Senator Torres Ray.
Senator Torres Ray votes no. Senator Kent.
I report a no for Senator Wickland.
Senator Wickland votes no. Senator Gazelka, I'll now call on you to report the members who are voting remotely. Senator Gazelka.
Senator Bruce Anderson votes yes.
Senator Anderson B. votes yes. Senator Gazelka.
Senator Dames votes yes.
Senator Dames votes yes. Senator Gazelka.
Senator Eichhorn votes yes.
Senator Eichhorn votes yes. Senator Gazelka.
Senator Hall votes yes.
Senator Hall votes yes. Senator Gazelka.
Senator Housley votes yes.
Senator Housley votes yes. Senator Gazelka.
Senator Ingebrigtsen votes yes.
Senator Ingebrigtsen votes yes. Senator Gazelka.
Senator Johnson votes yes.
Senator Johnson votes yes. Senator Gazelka.
Senator Lang votes yes.
Senator Lang votes yes. Senator Gazelka.
Senator Newman votes yes.
Senator Newman votes yes. Senator Gazelka.
Senator Senjum votes yes.
Senator Senjum votes yes. Senator Gazelka.
Senator Weber votes yes.
Senator Weber votes yes. Senator Gazelka.
Senator Westrom votes yes.
Senator Westrom votes yes. All members having voted who have the desire to vote, the Secretary will close the roll. There being 33 ayes and 32 nays, the decision of the President is sustained. All right, members, we are back on Senate File 1098 as amended. I don't have anyone else on the list to speak prior to third reading. I do have a couple members who would like to speak after third reading. Are there any other amendments on Senate File 1098? The Secretary will give Senate File 1098 its third reading.
Senate File Number 1098, a bill for an act relating to health establishing the Prescription Drug Price Transparency Act.
Third reading. All right, members, I have a list started. First on the list is Senator Benson, followed by Senator Nelson. Senator Benson.
Thank you, Mr. President. One of the reasons I signed on to this bill early is because I believe that sunlight is the best transparency. And you'll see many yes votes today. Some will be votes to teach pharma a lesson. Others will be more subtle because the public and the press need to have information about the rising cost of drugs. But there are some things missing. Rebates might be reported in other places, but those of us who followed insulin know that rebates are a significant factor in setting the wholesale average cost of a drug price. We know that our Department of Human Services gets over $600 million in rebates. Nowhere in this bill is the impact of rebates on rebates outlined in the way it impacts prices. For example, if the federal government mandates a rebate that drives up the cost 10%, the manufacturer would still have to report that in this bill, even though it wasn't because of their actions. Keep in mind, we are also in a new paradigm. Many pharmaceutical manufacturers moved overseas to save costs in manufacturing. We're trying to get them to move back to this country because we've seen the risk that our Chinese supply chain causes to our overall healthcare system and our ability to protect our own people. So where is the consideration for the rising cost of manufacturing for those companies who decide to move out of China? And will this have a chilling effect on companies who may decide to move to Minnesota? And a word of caution to the large swath of people who support this bill. If you benefit from rebates, then you benefit from the high WAC price, because rebates only work because of a high wholesale acquisition cost. So if you're part of the healthcare system that uses rebates to backfill for other costs or to keep your external prices down, keep in mind that you will be asked to reveal the role of rebates at some point in the future. Not in this bill, but I can tell you with a great deal of certainty, this is not the end. This is the beginning of digging into what markups there are in other parts of the pharmaceutical supply chain. For trade secrets, if you think this is the end of the trade secret discussion, I remind you to go back to 2014, where we tried to get disclosure on some of our health plans. This is the beginning of disclosures of trade secrets. and people at the Minnesota Department of Health will be deciding what should be disclosed and what should not be disclosed when you get to go to court. And it's not going to stop with the pharmaceutical industry. It is going to be spread far and wide. Everyone supports transparency, but not everyone supports every provision in this bill. I know there are many members who are going to be uncomfortable, but are going to vote yes because they want some accountability in the system. Senator Rosen has done yeoman's work trying to find that balance. But in order to get to some sort of agreement with the House, we are putting at risk those who use rebates to lower their external prices or to backfill for other costs, and those who would depend on trade secrets. And again, it will not stop with pharmaceutical manufacturers, and it will not stop with pharmaceuticals. And so as you vote yes, and as you support this bill, as I will be doing today, I am doing it with my eyes wide open. The fight over price transparency begins with this bill, and the fight over protecting trade secrets has only just begun.
Further discussion on the bill. Next on the list is Senator Nelson, followed by Senator Hayden. Senator Nelson.
Thank you, Mr. President. This is a topic that is so important to every one of us and all of our constituents. We know the rising cost of health care has largely been being driven by the rising cost of pharmaceuticals. And I thank Senator Rosen for putting together a bill that brings transparency to that aspect. And I believe it does follow on the good work that we've done previously in addressing the PBMs, the pharmaceutical benefit managers, and bringing some light to that so that that was not a middleman. They were not middlemen that were actually driving up the cost of pharmaceuticals. And we've seen some light there. We've seen some reactions already there. And also in our efforts that have driven down the cost of insulin by not allowing profits to be made on this very old drug that's been around for decades now. And so we've seen good results, and I'm sure we'll see good results from this transparency bill too. I do have just one question in the back of my mind, and I'm going to ask Senator Rosen if she could yield to that question.
Senator Rosen will yield. Senator Nelson.
Thank you. My only concern is that we know that new drug development is what we are looking for many of the illnesses, the diseases that are so impacting our society. Actually, we'll be looking for new development with COVID-19, new drug development. New therapies are being developed right now. And that's how we're going to win over this pandemic. Testing, therapies, treatments, vaccines. But there's many other ailments that we have not yet developed drugs for that we know someday we'll be able to help cure or lessen the negative impacts, provide better quality of life. I'm thinking about things like Alzheimer's. We want to be living at a time where we're going to see the first survivor from Alzheimer's. We're counting on pharmaceutical innovations to drive those type of drugs. And so I would just ask if Senator Rosen could spend just a few minutes talking about how, while this is right, driving this price transparency is important. How are we doing that without putting a chilling effect on the development of those new life-saving and life-changing drugs that so many are waiting for?
Senator Rosen.
Thank you, Mr. President, and thank you, Senator Nelson, for the question. As we have gone through this bill today, as you know, the new drugs has a totally separate area of reporting. And what is asked for these new drugs to report is different than the existing and the newly acquired. It's the price of the drug, whether the FDA granted the drug a breakthrough therapy designation or a priority review, which is public knowledge, could be public knowledge, the direct cost to manufacture, to market the prescription drug, including an advertising cost, and to distribute the prescription drug, the patent expiration date, and the research and development. The research and development is not part of it. So that was something I want to make a strong point, that research and development is not being asked for review here in this bill. It was in the bill last year and it was taken out. And the drug manufacturers are still able to perform ongoing research and development and still make a profit. And as you know, research is not only done by drug manufacturers, it's done by the National Institute of Health and a lot of our public institutions, such as the University of Minnesota. So there's nothing in this bill that is going to tamper down any profits, anything for them to say, no, I don't want to do any more development. All they have to do is disclose some information on why the price of the drug is what it's at.
Further discussions, Senator Nelson.
Thank you, Mr. President. And Senator Rosen, thank you for that great clarification. We know how important this is. This is a good bill. I will be supporting this bill. It will help drive down prescription drug costs and allow for the R&D that is so important to those new drugs that we are going to see in our lifetime that are going to conquer some of these diseases and long-time effects that our constituents have been struggling with. So thank you for the good work. I encourage a green vote.
Next, I have Senator Hayden, followed by Senator Dibble.
Well, thank you, Mr. President, and I just have a few brief questions. I'm glad the bill is on the floor, though a little disappointed that some of our amendments couldn't get on to make the bill even a better bill, especially for our small pharmacists and others. I'm disappointed that we don't somehow see the pharmacy benefit manager and the role that they play in pharmaceuticals as germane to this bill. And I will say this, we should have transparency. We should see how much everybody is paying. I don't want to get into the trade secret side of things, but I certainly would hope that even the rebates that we receive from government, we should take a look at it. I think the slippery slope analogy, I think this is a slippery slope and a slope we should go down. We should take a look at it. We got people, our citizens, Minnesotans, every single day not being able to afford their medication, having to make a choice between should they get something to eat, should they pay their rent, or should they take the medicine that's going to help them live a better life or maybe even save their lives. I think this gives an opportunity for us to see the amount of money. Senator referenced that this could end up in a lot of litigation. Well, certainly don't want taxpayers to pay for it, but the pharmaceutical companies got enough money. They got enough money. They made the money off our backs to be able to keep fighting. And I wish we would have offered Senator Champion's bill that shows where pharmaceutical companies often, when the patent is going to end, that they somehow get in and tie this thing up in litigation in order to make just a few more dollars off of our backs. There are so many other things that we need to do and continue to do, and I understand that this session has not played out like we thought, and we didn't have the opportunity to talk about this in all of the various committees and get all of the bills through, and certainly Senator Limmer talked a lot about that and the compressed nature of his committee and the bills that aren't being heard there. I know I got a few that are caught up in his committee as well as seems like a lot of us do. So it is time for us to be able to pass this bill, but we should do more. And when we get over this tragedy or this tragic situation we're in of COVID-19 and we can get things a little bit back to normal and we can have a full session, or maybe even if the governor decides to call us back, hopefully we can do more of this work. This is a good start, and I know Senator Rosen worked extremely hard to try to put the stakeholders together, and I know how hard that often is. But hopefully we can continue the work of this. We can shine the bright light, the sunshine on what's going on in the pharmaceutical industry, the pharmaceutical benefit managers, but the end user, either the pharmacy, the small pharmacy in Newport that Senator Bigham told me about, or the actual patient, doesn't have to take the brunt of this issue. And we can also continue the innovation of figuring out how we get a drug that's either on the market or one that we're going to perfect in order to deal with this issue that we have today, COVID-19 that's in front of us, or even things that we don't know about or diseases that we're trying to cure today, cancer and others. So I don't think this will have a chilling effect. I think it helps us to hold people accountable, and hopefully those drug manufacturers that think that somehow it's the nice thing to do, it's the novel thing to do, to take an existing drug that's been researched and developed and push the price up beyond belief just because they can, just because they need it, and just because they have the system rigged to go in their favor. Hopefully this is the first step to shining the bright light on that. Mr. President and Senator Rosen, I just want to thank you for bringing the bill, and I am also going to support it, but once again really wish that we could have made the bill better with the amendments that we offered.
Further discussion on the bill, Senator Dibble.
Thank you, Mr. President. Thank you, members. I would hope to keep my comments brief. I wasn't intending to speak, but I felt like I had to respond to a few of the arguments that have been made here on the floor at the conclusion of this bill. I'm going to vote for this bill. It is a start. However, I'm very sorry that Senator Marty's amendments didn't go on. I heard some defense and some fear of the pharmaceutical companies' ability to earn sufficient profits to continue research and getting needed drugs to market. Members might remember the situation that I described when we were debating the insulin bill before we went out into this hiatus before we passed the bill a few weeks ago. And that's the case of Gilead and the pharmaceutical drug PrEP, which they didn't actually do the research for. They offloaded that. They actually resisted it, but in many cases, pharmaceutical companies simply allow other entities, public entities, universities and the like, to do research for them, and then take that in and market that drug under that use or that newly construed use. That's exactly what happened with PrEP, one of the drugs that was part of the combination drug therapies to suppress HIV in an individual. And the theory was that maybe one could be used on a prophylactic basis and not allow HIV infection. It was proven to be 100% effective. Gilead then went and started manufacturing and selling that drug for that purpose. It cost Gilead $60 a year to manufacture that drug. They charged $20,000 a year for a prescription. Members, please think about that for a minute. They did none of the research. The taxpayers supported that research. They manufacture the drug. It costs them $60 a year to manufacture, and they charge $20,000 a year. As a matter of fact, that price, even though it's available to some people through their health care benefits, to many it's not, because of course we have these fake health care plans parading as high deductible plans. Those are non-health care plans. And we have a lot of people who simply don't have health care. And so they're excluded. So in fact, we live in an era when we could bring new transmissions of HIV in our country down to 0 if people get effective access to treatment once they're affected or can prevent being infected in the first place. And yet we've plateaued, and we see in Minnesota alone just 300 new infections per year, and we've been turning in those results for 10 years. That is at the feet of the pharmaceutical companies that are making profits that are beyond anything that we can possibly imagine. There will be no danger of the pharmaceutical companies not continuing to make very, very handsome profits if we're able to somehow, some way, get a handle on these unconscionable prices. And if we also begin to build in policies that get at the drivers of those prices, like the pharmacy benefit managers that benefit from that delta, that differential. And rebates, why do we even have rebates? Because of the unconscionable prices that the pharmaceutical companies are charging. So members, I'm glad we're at the threshold of a discussion. That's what this bill feels like. But please, we are absolutely seeing people's lives and health and ability to thrive undermined and even worse by an industry that has no conscience, that puts outrageous profits at the forefront. These are not companies that exist for the public's benefit or the public's interest. That is our job, members, and let's get back to that work. Thank you, Mr. President.
Further discussion on Senate File 1098 as amended. Senator Marty.
Thank you, Mr. President. Members, this bill is, as I think several of you have mentioned, a small step forward. It does increase transparency. Again, I'm very disappointed. I mean, Senator Benson was saying how the rebate system and how that affects prices of drugs. Boy, I'd give anything to get rid of that stupid rebate system, which comes from the manufacturers and the PBMs, not from others. And to say that we can't talk about that because there's more prescription drug price transparency, which is what this bill is about, is disappointing. So one problem with the bill is it's not as much transparency as it should be. It's good what we have, but it's not enough. Then the other one is that they're basically, the only enforcement in this bill is if you don't disclose it, you're ripping us off. We're going to penalize you for not disclosing it. We're not going to penalize you for ripping us off. We're just going to penalize you for not disclosing it. So as long as you tell us you're going to rip us off, then you can get away with it. That's why that one amendment I offered earlier, there's another one that I believe Senator Jensen offered that came out of the Attorney General's drug pricing task force. I can think of 5, 6, 7, 8 or so of our DFL members who have offered bills to try and break this stranglehold that the pharmaceutical industry has on Minnesota consumers. They're not getting heard. I wish they were. I wish we could do that. I understand why Senator Rosen has this agreement she's got with it, and all the stakeholders. Well, the only stakeholders who would disagree with any of the things that we were offering is, one, the PBMs, and two, the manufacturers. Nobody else wants to be taken advantage of like this. So I'm disappointed we couldn't go further. I think that this is a crisis. You think back to EpiPens, you think back to the insulin fight we had earlier this year. We're dealing with these drug problems one at a time, and they're ripping us off blindly, and then, oh, well, we can stop them and limit them a little bit in this area. But we've got to keep moving forward on this. We've got to move a lot more aggressively because it's hurting people. And the industry is shameless. They lobbied Congress this year during the COVID crisis to make sure any vaccinations that they come up with for COVID don't have an unconscionable limit in them, pricing limit in them. They fight against that. So even though government is heavily involved in the research for breakthroughs on these drugs, even during a crisis, they're trying to profiteer extremely. I appreciate the governor putting in place a price gouging law temporarily under the executive order during the crisis, because it's always been considered obscene for people to price gouge and so on during times of crisis. We try and do that, so if somebody goes and buys a lot of toilet paper and tries to rip off people, or hand sanitizer, tries to jack up the price on people, that's against the law, as it should be when you double, triple the prices on it, because you can take advantage of people in a crisis. Big Pharma doesn't care. They're trying to do it. They're trying to do it at the same time we're helping develop vaccines. So I think this bill is, I'll say, a small step forward. It doesn't go far enough in transparency, and transparency alone doesn't do it. You have to say it's not okay to rip people off. We have to enforce that. I wish these amendments had gone on. We had plenty more could have offered, but as it is, we'll take this as a small step and keep fighting.
Further discussion on Senate File 1098 as amended. Senator Rosen.
Thank you, Mr. President and members. I would just like to personally not only thank all the stakeholders that have been involved in this bill, that have sat through countless hours of negotiation and fighting and texting and redoing things. And Senator Benson, your work last year and with your staff, I really appreciate it. But I also like to just point out Representative Morrison, who has done an amazing job with this bill too in the House. And it was agreed upon by both of us to craft a bill, a very delicate bill together to make sure that we could move this issue forward. And especially now with the issue of COVID-19 and the uncertainty of what our session is going to look like, it's even more important to have something that we can join hands together and say it's bipartisan, and we expect and look forward to the governor's signature on this bill. And believe me, members, some of the stakeholders that are supporting this bill right now are going to hate me next week when prior authorization becomes complete and we finally get a deal on that bill, which is very, very important to healthcare cost. In a couple just questions or answers to some of the comments about rebates, there is reporting for rebates in 62W and the PBM law that we passed last year, and also Commissioner of Commerce you have to report to them on the rebates, which starts 6/1 of 2020. And the trade secret issue, that very, very heavily discussed issue, and I feel like we came up with something that is about as tight and the most secure as any state has. No public data under Section 13.02 will be posted with the commissioner. No, and if the trade there's no posting for trade secret information under Section 13.37 and under the federal trade secret laws of the Defend Trade Secret Act of 2016. And then, of course, we have the off-ramp of the ability to write to the department why you don't want your information listed, and a 30-day notice for MDH. And again, members, if they increase their price, the manufacturers, if they increase their price over 10%, that's when it kicks in. And I don't think we've quite understand that they can still have a 10% margin. So there's a lot of maneuver to work here. The healthcare and delivery is changing all across the state, all across the nation, and the relationship between the patients and the system absolutely needs to be transparent. This bill builds on the good work, starting with the PBM bill that we did last year, the insulin bill from this year, all the work and the movement in telemedicine. Healthcare delivery is changing as we speak, and transparency and accountability is key. And in beginning to get the consumer engaged, empowering the consumer is very, very important. So making the pharmaceutical companies more transparent and more accountable, and having them think again before they have this horrendous increases in their prescription costs is something that we are attaining to in Senate File 1098. With that, members, I appreciate your indulgence, your patience, and I humbly ask for your support for this bill. Thank you.
Final discussion on Senate File 1098 as amended. Senator Gazelka.
Thank you, Mr. President. Members, listening to the debate over this bill, and I am going to support the bill. It's not a perfect bill. As we've been trying to move towards driving down the cost of health insurance and making it more accessible, affordability and accessibility are some of our important benchmarks that we've been working towards. This does that. But I do want to just highlight, there's a lot of constantly complaining about pharmaceuticals, and I don't want us to forget what they actually do for us. Some people try to boil it down to the cost of manufacturing as if that's the only thing that makes it valuable or expensive. And I was just thinking about the art pieces that we love, the masterpieces. Frankly, if you boil it down to just the paint, it really didn't cost much, but in fact it's priceless. Or the human body, if it just goes back into the earth, the actual chemicals that make up our human body are not much, even though it's priceless. And so it is with the prescription drugs that we've come to depend on, whether it's, I don't even want to mention a particular drug, but all of the different drugs that have come out in the last 10 years that make our lives better is frankly remarkable. And the fact that we're going to have a vaccine for COVID-19 that will protect our lives and help us get on with our living is going to be remarkable. And so I never want to forget that side of it as well. There is going to be some accountability in this, and I think that's what people are asking for, but it was not meant to be punitive. It was meant to be accountability. And so if prices go up over 10%, then we want to know why. If in a 2-year period the prices go up over 16%, we want to know why. And that's the accountability that we're bringing into this. But for me, it was important that their trade secrets are defended. It doesn't matter the industry to me. If they have a trade secret, we should be all protecting those so that the free market can work the way it's supposed to. But then overall, about what we've been trying to do, this is one of many bills that the Republicans that have had leadership here have been working on over the last 4 years. And just to highlight this one with the rest, in 2017 we did reinsurance, which stabilized the insurance market. And now we actually have more insurance companies that are in, and we have some of the lowest prices in the whole country as a result of that. We cracked down on surprise billing practices that left Minnesotans with huge bills, largely uncovered by insurance. We opened up the state's insurance market to create greater competition and more innovation. We allowed agriculture co-ops to begin offering health plans to their members, a move that has been hugely successful. We expanded across access to telemedicine and ensured high standards of care using new technology. That was 2017. Then in 2018, we provided transparency to consumers by giving patients the right to an estimate of their costs for procedures so that they can make informed decisions and avoid surprises. In the supplemental omnibus, it included needed protections against pharmacy gag orders, overcharging for prescriptions, surprise fees at clinics, and new opportunities to expand telemedicine. That one was vetoed, though. In 2019, we extended the wildly successful reinsurance program to keep the market stable and affordable. We required parity for mental health coverage to ensure access to those in need on the individual market. And we dramatically reformed the way we care for seniors by creating new protections for folks in senior living facilities and reforming how the state regulates those entities. We also responded to the opioid epidemic with a package of reforms aimed at reducing the amount of drugs reaching the streets in every step of the supply chain. We created nation-leading consumer protection systems by licensing pharmacy benefit managers, requiring them to act in good faith and allowing pharmacies to fight back. We provided new sunlight on opaque billing practices by requiring transparency in hospital bills. We reformed the hospital moratorium process so we could better allow for the growth and change in our hospital marketplace. Members, this is pretty amazing, all of the things that have actually happened in the last just few years. And I didn't even mention that we got insulin done and helped to drive down the cost of that. And so this was a promise that we made, and I want to say this is another promise kept because a lot of members of this Senate, Republicans and Democrats, rolled up their sleeves and continue to work to make sure that Minnesota leads the way to provide access to health care at affordable price.
Members, we're on final discussion for Senate File 1098 as amended. Senator Marty.
Mr. President, I wasn't going to speak again. I understand Senator Gazelka's having last comments on every bill. But at a certain point, it certainly sounded like a 5-minute praise, and members are allowed to praise themselves in their caucus. That's appropriate. Everybody does it. But at a certain point, it sure sounds a lot like a campaign speech. We kept our promises on this and this and this. I'm looking at all those things that you say you did. This bill is this much. It's a tiny drop of what we have to do to get prices under control. I'm voting for it because it's a step forward, but a small step. You go on and on about, oh, we did this and we did this while the world's all taken care of. Our folks are getting ripped off on pharmaceutical prices. The whole healthcare system's got a lot of problems. And I'm sorry, I mean, there's partisan disagreement here because I don't think all these things are that great. But I just want to say that when you give speeches on the floor, we understand you're going to praise your party. But it just sounded an awful lot like a campaign speech, and I don't mean to say that was the intent, but it certainly went on about that on things that I think a lot of them were pretty trivial and pretty weak. And to claim them as big victories, I'm sorry, I just disagree.
Members, Senator Gazelka.
Thank you, Mr. President. I think working together to drive down the cost of health insurance and make it more accessible and more affordable is a goal that we all should be doing. It's one of the promises that I've said that we were going to do here. I'm actually surprised that you would get up again. You know the protocol here, and you have an opportunity to speak. And so I'm surprised because this is something that has happened more than once.
Members, we're on final passage of Senate File 1098 as amended. Seeing no further discussion, the Secretary will take the roll. Members, after you vote at your desk, please exit through the front door of the chamber. Members in the retiring room, please come to the chamber, vote at your desk. Members in the East Gallery, please make your way down to the chamber. While they're making their way down to the chamber to vote, members in the President's office, please come to the chamber and vote. Please vote at your desk and exit through the front door of the chamber. Members in room 303, please come to the chamber and vote. 303, and while they're heading down, members in room 237, please come to the chamber and vote at your desk. 303 and 237. Members in room 323, please make your way down to the chamber and vote. And while they're heading down, members in room 206, please come to the chamber and vote. 323 and 206. I will now call on Senator Kent to report the votes for the members voting remotely. Senator Kent.
Thank you, Mr. President. I report an aye for Senator Bigham.
Senator Bigham votes aye. Senator Kent.
I report an aye for Senator Carlson.
Senator Carlson votes aye. Senator Kent.
I report an aye for Senator Clausen.
Senator Clausen votes aye. Senator Kent.
I report an aye for Senator Dietzick.
Senator Dietzick votes aye. Senator Kent.
I report an aye for Senator Chris Eaton.
Senator Eaton votes aye. Senator Kent.
I report an aye for Senator Isaacson.
Senator Isaacson votes aye. Senator Kent.
I report an aye for Senator Klein.
Senator Klein votes aye. Senator Kent.
I report an aye for Senator Lane.
Senator Lane votes aye. Senator Kent.
I report an aye for Senator Latz.
Senator Latz votes aye. Senator Kent.
I report an aye for Senator Newton.
Senator Newton votes aye. Senator Kent.
I report an aye for Senator Pappas.
Senator Pappas votes aye. Senator Kent.
I report an aye for Senator Rest.
Senator Rest votes aye. Senator Kent.
I report an aye for Senator Sparks.
Senator Sparks votes aye. Senator Kent.
I report an aye for Senator Torres Ray.
Senator Torres Ray votes aye. Senator Kent.
I report an aye for Senator Wickland.
Senator Wickland votes aye. I will now call on Senator Gazelka to record the votes of the members voting remotely. Senator Gazelka.
Thank you, Mr. President. Senator Bruce Anderson votes aye.
Senator Anderson B. votes aye. Senator Gazelka.
Senator Dames votes aye.
Senator Dames votes aye. Senator Gazelka.
Senator Eichhorn votes aye.
Senator Eichhorn votes aye. Senator Gazelka.
Senator Hall votes aye.
Senator Hall votes aye. Senator Gazelka.
Senator Housley votes aye.
Senator Housley votes aye. Senator Gazelka.
Senator Ingebretson votes aye.
Senator Ingebretson votes aye. Senator Gazelka.
Senator Johnson votes aye.
Senator Johnson votes aye. Senator Gazelka.
Senator Lang votes aye.
Senator Lang votes aye. Senator Gazelka.
Senator Newman votes aye.
Senator Newman votes aye. Senator Gazelka.
Senator Senjum votes aye.
Senator Senjum votes aye. Senator Gazelka.
Senator Weber votes aye.
Senator Weber votes aye. Senator Gazelka.
Senator Westrom votes aye.
Senator Westrom votes aye. All members having voted who have the desire to vote, the Secretary will close the roll. There being 63 ayes and 2 nays, the bill is passed and its title agreed to. The next bill up for consideration is number 42 on general orders, Senate File 3358, Senator Ruud.
Thank you, Mr. President and members. Before we start to talk about the bill today, I do have the A6 amendment. And members, this is simply a technical amendment.
Senator Rude offers the A6 amendment. The Secretary will report the amendment.
Senator Rude moves to amend Senate File 3358 as follows: delete everything after the enacting clause and insert Section 1. This is Amendment A-6.
Discussion on the amendment. Senator Rude.
Thank you, Mr. President. This is simply a technical amendment on line 1.25. We're just simply changing the word section to subdivision to make the wording the way the reviser would like it. So, very simple technical change.
Any discussion on the A6 amendment? Seeing none, all those in favor say aye. Aye. Opposed say no. We will take a brief pause to gather the votes in the alternate locations. Receiving a sufficient number of aye votes, the motion prevails and the amendment is adopted. Senator Rude.
Thank you, Mr. President and members. Senate File 3358 is all about summer jobs, allowing 16 and 17-year-olds to have fun summer jobs. I'm going to lighten up the mood in this chamber a little bit and take you back to my district, Paul Bunyan. When you walk into Paul Bunyan land, and Paul Bunyan there, the giant Paul Bunyan, says, "Hi, Karen from South St. Paul, come on in." And I'm sharing that memory from Senator Housley because she couldn't be here today in Chambers, and she relayed to me how much fun she remembers going to Paul Bunyan land. And I think there are many folks around the state of Minnesota that remember seeing Paul Bunyan land. And when he says hello, the magic begins and the wonder of how did he know my name begins. So the owners of Paul Bunyan land employ a lot of our high school children. Paul Bunyan land is located between the Brainerd and the Crosby school districts, and it's one of the most sought after jobs for young people in our area. They start their hiring process in the spring, and what has typically happened is they have used for years, 15 years as a matter of fact, a waiver system. They hire their high school kids, they come in and they fill out the forms. They bring the waiver home to their parents, so their parents have to sign it so that they know exactly what they'll be doing for the summer. The children bring, or the students, kids, bring back the waiver back to the park, and the owners of the park sign it and send it off to the Department of Labor and Industry. It's been that way for 15 years. It's worked very well. I'll tell you, the kids that work in that park are well sought after they've worked there because they learn this wonderful work ethic. It's a great job because it's from Labor Day or Memorial Day to Labor Day, and it's from 10 to 6. So the kids don't have to get up early in the morning, and they still have enough left of their day to go to the beach or have fun after their job. So last year, the park owners did what they normally do. They hired their kids, filled out the waivers, and sent them in to DOLI, the Department of Labor and Industry. And last year, the commissioner decided the new commissioner decided she was no longer going to use the waivers in that way and denied every one of their waivers, leaving Paul Bunyan Land with no workforce for the summer. No reason for it, no explanation for it. She just decided that that wasn't something she was going to do anymore after 15 years. It left them in really pretty dire straits last year for the summer season with no help, and they struggled greatly. So in January, they came to me and said, could you help us? We don't know why we can't use the waiver system anymore. We have no way forward. So we worked I mentioned this to Senator Pratt, who's in the Jobs Committee, and he also found that he had the same problem with Valley Fair and other places around the state. So we met with the commissioner to see if there wasn't some way forward that we could get these jobs for our 16 and 17-year-old kids to work. So we've worked on this bill for many months now, trying to put together a framework of how these kids could be hired to go to work. These are very safe jobs for them. And so what you have in front of you puts that framework together, and it's agreed to by all the parties that worked on this and the DOLI commissioner. So it really sets a guideline about supervision, training, what needs to happen in order for these 16 and 17 years old to work. And I will tell you that, of course, Paul Bunyan Land isn't as sophisticated as the big parks, but they have a 100% safety rating, and they do a really good job of their park, even though it is a smaller park. And if you had seen the wonderful training and video that we saw for what happens when a person that's operating the rides at Valley Fair, what they go through, it is simply amazing. It is absolutely redundant with safety issues. And so I think this bill is something that's really needed to get our 16 and 17-year-olds to work, and I would stand for questions.
Discussion on Senate File 3358 as amended. Seeing no further discussion, the Secretary will give Senate File 3358 its third reading.
Senate File 3358, a bill for an act relating to employment, providing for the minimum age for safe amusement ride operation.
Third reading. Final discussion on the bill. Senator Pratt.
Well, thank you, Mr. President, and I want to thank Senator Ruud for bringing this bill forward. This is an important bill for our young people who are looking for those first jobs. As she said, this was work with the operators and with the Department of Labor and Industry, where we incorporated several aspects around what needed to be in the ride operator requirements, and then the industry working with DLI that, in fact, nationally, 16, 17-year-olds are allowed to operate these fixed rides. And that this rule, we found out, was adopted back in the 1970s before many of the safety protocols that Senator Ruud mentioned existed. So I want to thank Senator Ruud for pulling this together along with the stakeholders. This is really important, especially as where we are today, in understanding that hopefully soon we get Minnesota back to work. Hopefully soon we get to some semblance of normal. And I don't know what the future holds for large places like Valley Fair or smaller places like Paul Bunyan Land when it comes to social distancing. But at least if they are able to operate, they can start to hire these kids today and hopefully get them a job around Memorial Day. So, Mr. President, I encourage members to vote in favor of the bill.
Final discussion on Senate File 3358 as amended. Senator Marty.
Mr. President, Senator Rood, I'm not sure how to feel about this. I think it sounds a perfectly reasonable bill. In 2006, we had a couple of amusement rides, one at Valley Fair, I believe, that had 15 people hospitalized, and one in Hinckley that had a couple of people. One of them was critically injured. And we did pass a bill the following year. We successfully passed one and put some regulation in place. My concern is always the industry always says, well, of course we want to do this safely. And I guess the one question I'll ask is, not that a 16 or 17-year-old can't do a very good job of amusement ride, putting people on it and so on, but if there's an adult who's getting on the ride and they're doing something that's inappropriate, sometimes a 16-year-old might be a little bit shy about enforcing a rule or something. And this seems like a reasonable change. I guess I just wonder, because were there people talking about safety in the discussions you've had?
Senator Rood will yield. Senator Rood.
Thank you, Mr. President and Senator Marty. You know, that's a really good question, and one of the things that this bill does is make sure that there's a supervisor available and in sight at all time. So I think if that young person had an adult that was causing problems, I do believe that they would be able to signal to their adult supervisor, and they would be right there. I know in the Paul Bunyan Land, you can stand in the middle of the park and you can see the whole park from the center, and so I know they have several supervisors around there, and in Valley Fair they have many supervisors. So I think that number one, the training that these children have, or these 16 and 17-year-olds, it's very valuable for them to have that. But the supervision, so that, you're right, it's very difficult for a 16 or 17-year-old to face an adult that's maybe being a little rowdy. And so the supervisor being right there, I think, answers that question.
Members, we're on final discussion for Senate File 3358 as amended. Any closing comments? Senator Rood.
Thank you, Mr. President and members. I really appreciate a green vote on this. This will help them go forward this summer, but I also wanted to comment on the fact that we worked really hard to put in place a framework for 16 and 17-year-olds to have jobs. It's very important for them to develop a work ethic and to have a summer job, and to learn how to earn money, save money, take care of themselves, and really have some what we call social skills, some soft skills, some customer skills. And so I think going forward, I would like this body to look at how we can put forward more structures and implementation so that we can get our 16 and 17-year-olds safely back to work. So thank you, Mr. President. Members, I encourage a green vote.
Members, we're on final passage of Senate File 3358 as amended. Seeing no further discussion, the Secretary will take the roll. Members in the retiring room, please come to the chamber and vote at your desk. Members in the East Gallery can make their way down to the chamber. And while they're making their way down, members in the President's office can come to the chamber and vote at your desk. Members in room 303, please make your way to the chamber and vote at your desk. Members in room 237 can also come to the chamber and vote. Members in room 323, please make your way down to the chamber and vote. While they're making their way down, members in room 206, please come to the chamber and vote. 323 and 206. I will now call on Senator Kent to report the votes of the members voting remotely. Senator Kent.
Thank you, Mr. President. I report aye for Senator Bigham.
Senator Bigham votes aye. Senator Kent.
I report aye for Senator Carlson.
Senator Carlson votes aye. Senator Kent.
I report aye for Senator Clausen.
Senator Clausen votes aye. Senator Kent.
I report aye for Senator Dietzick.
Senator Dietzick votes aye. Senator Kent.
I report aye for Senator Eaton.
Senator Eaton votes aye. Senator Kent.
I report aye for Senator Isaacson.
Senator Isaacson votes aye. Senator Kent.
I report aye for Senator Klein.
Senator Klein votes aye. Senator Kent.
I report aye for Senator Lane.
Senator Lane votes aye. Senator Kent.
I report aye for Senator Latz.
Senator Latz votes aye. Senator Kent.
I report aye for Senator Newton.
Senator Newton votes aye. Senator Kent.
I report aye for Senator Pappas.
Senator Pappas votes aye. Senator Kent.
I report no for Senator Rest.
Senator Rest votes no. Senator Kent.
I report aye for Senator Sparks.
Senator Sparks votes aye. Senator Kent.
I report aye for Senator Torres Ray.
Senator Torres Ray votes aye. Senator Kent.
I report aye for Senator Wickland.
Senator Wickland votes aye. I will now call on Senator Gazelka to report the votes of those voting remotely. Senator Gazelka.
Senator Abler votes aye.
Senator Abler votes aye. Senator Gazelka.
Senator Bruce Anderson votes aye.
Senator Anderson B. votes aye. Senator Gazelka.
Senator Dames votes aye.
Senator Dames votes aye. Senator Gazelka.
Senator Eichhorn votes aye.
Senator Eichhorn votes aye. Senator Gazelka.
Senator Hall votes aye.
Senator Hall votes aye. Senator Gazelka.
Senator Housley votes aye.
Senator Housley votes aye. Senator Gazelka.
Senator Ingebretson votes aye.
Senator Ingebretson votes aye. Senator Gazelka.
Senator Johnson votes aye.
Senator Johnson votes aye. Senator Gazelka.
Senator Lang votes aye.
Senator Lang votes aye. Senator Gazelka.
Senator Newman votes aye.
Senator Newman votes aye. Senator Gazelka.
Senator Senjum votes aye.
Senator Senjum votes aye. Senator Gazelka.
Senator Weber votes aye.
Senator Weber votes aye. Senator Gazelka.
Senator Westrom votes aye.
Senator Westrom votes aye. All members having voted who have the desire to vote, the Secretary will close the roll. There being 65 ayes and 2 nays, the bill is passed and its title agreed to. The next bill up for consideration is number 55 on general order, Senate File 3197, Senator Kiffmeyer.
Thank you, Mr. President and members. Mr. President, before I start describing the bill, I have the A2 amendment to Senate File 3197.
Senator Kiffmeyer offers the A2 amendment. The Secretary will report the amendment.
Senator Kiffmeyer moves to amend Senate File number 3197 as follows. Page 2 after line 10, insert. This is the A2 amendment.
To the amendment, Senator Kiffmeyer.
Thank you, Mr. President. The Senate File 3197 is regarding variances for family child care providers. Variances come from the county, and the amendment also deals with variances, very specific, very fitting with Senate File 3197. The A2 amendment on page 1 says counties shall use a uniform application form for variance requests by family child care providers. And in the next section, it is the direction to use that form when making variances. So that is the essence of the amendment, Mr. President.
Any discussion on the A2 amendment? Seeing none, all those in favor of the amendment say aye. Aye. Opposed say no. We will take a brief pause to gather the votes and the alternate locations. Receiving a sufficient number of aye votes, the motion prevails and the amendment is adopted. Senator Kiffmeyer.
Thank you, Mr. President. To Senate File 3197 as amended. The additional sections that are included in this bill have to do with family child care centers. When a single preschooler uses an individual private restroom within the classroom with the door closed, supervision occurs when a program staff person has knowledge of the child's activity and location, can hear the child, and checks on the child at least every 5 minutes. Another section has to do with the variances. A county agency that has been designated by the commissioner to issue family child care variances must publish the county agency's policies and criteria and annually distribute those policies and criteria to all family child care license holders in the county. This is very important, Mr. President. This is very important to our family child care providers. We have 87 counties. What we, as much as possible, want to have consistency across all 87 counties and also transparency as far as the policies and procedures. With that, Mr. President, I submit Senate File 3197 as amended and ask for a yes vote. Thank you.
Further discussion on Senate File 3197 as amended. Seeing none, the Secretary will give Senate File 3197 its third reading.
Senate File Number 3197, a bill for an act relating to child care licensing.
Third reading. Members, any final discussion on the bill? We are on final passage of Senate File 3197 as amended. Seeing no further discussion, the Secretary will take the roll. Members in the retiring room, please come to the chamber and vote. Members in the East Gallery can make your way down to the chamber to vote. And members in the President's office, please come to the chamber and vote. Members in room 303, please come to the chamber and vote. While they're making their way down, members in room 237, please come to the chamber and vote. Members in room 323, please come to the chamber and vote. While they're making their way down, members in 206, please come to the chamber and vote. Room 323 and room 206. I will now call on Senator Kent to report the votes for those voting remotely. Senator Kent.
Thank you, Mr. President. I report aye for Senator Bigham.
Senator Bigham votes aye. Senator Kent.
I report aye for Senator Carlson.
Senator Carlson votes aye. Senator Kent.
Senator Clausen votes aye.
Senator Clausen votes aye. Senator Kent.
Senator Dietzick votes aye.
Senator Dietzick votes aye. Senator Kent.
Senator Eaton votes no.
Senator Eaton votes no. Senator Kent.
Senator Isaacson votes aye.
Senator Isaacson votes aye. Senator Kent.
I report no for Senator Klein.
Senator Klein votes no. Senator Kent.
I report aye for Senator Lane.
Senator Lane votes aye. Senator Kent.
I report aye for Senator Latz.
Senator Latz votes aye. Senator Kent.
I report aye for Senator Newton.
Senator Newton votes aye. Senator Kent.
I report aye for Senator Pappas.
Senator Pappas votes aye. Senator Kent.
I report aye for Senator Rest.
Senator Rest votes aye. Senator Kent.
I report aye for Senator Sparks.
Senator Sparks votes aye. Senator Kent.
I report aye for Senator Torres Ray.
Senator Torres Ray votes aye. Senator Kent.
I report aye for Senator Wickland.
Senator Wickland votes aye. I will now call on Senator Gazelka to record the votes of those voting remotely. Senator Gazelka.
Senator Abler votes aye.
Senator Abler votes aye. Senator Gazelka.
Senator Bruce Anderson votes aye.
Senator Anderson B. votes aye. Senator Gazelka.
Senator Dames votes aye.
Senator Dames votes aye. Senator Gazelka.
Senator Eichhorn votes aye.
Senator Eichhorn votes aye. Senator Gazelka.
Senator Hall votes aye.
Senator Hall votes aye. Senator Gazelka.
Senator Housley votes aye.
Senator Housley votes aye. Senator Gazelka.
Senator Ingebretson votes aye.
Senator Ingebretson votes aye. Senator Gazelka.
Senator Johnson votes aye.
Senator Johnson votes aye. Senator Gazelka.
Senator Lang votes aye.
Senator Lang votes aye. Senator Gazelka.
Senator Newman votes aye.
Senator Newman votes aye. Senator Gazelka.
Senator Senjum votes aye.
Senator Senjum votes aye. Senator Gazelka.
Senator Weber votes aye.
Senator Weber votes aye. Senator Gazelka.
Senator Westrom votes aye.
Senator Westrom votes aye. All members having voted who have the desire to vote, the Secretary will close the roll. There being 65 ayes and 2 nays, the bill is passed and its title agreed to. Remaining under motions and resolutions, we will now proceed to the confirmation calendar. Senator Osmek.
Thank you, Mr. President. I move that the report from the Committee on Energy and Utilities, Finance and Policy reported on February 24th, 2020, pertaining to the appointment of the Commissioner of the Public Utilities Commission be taken from the table.
On discussion on the OSMIC motion. Seeing none, all those in favor say aye. Aye. Opposed say no. We will take a brief pause to gather the votes from the members in the alternate locations. Receiving a sufficient number of aye votes, the motion prevails. Senator Osmic.
Thank you, Mr. President. I move that the foregoing report now be adopted.
On that motion, all in favor say aye. Aye. Opposed say no. Again, we'll take a brief pause to gather the votes of the members in the alternate locations. Receiving a sufficient number of aye votes, the motion prevails. Senator Osmic.
Thank you, Mr. President. I move that in accordance with the report from the Committee on Energy and Utilities, Finance and Policy reported February 24th, 2020, the Senate, having given its advice, now do consent and confirm the appointment of Valerie Means as Public Utilities Commissioner from Prior Lake, effective April 22nd, 2019, for a term expiring on January 6, 2025.
Discussion on that motion. Senator Osmic.
Thank you, Mr. President. Valerie Means was appointed or nominated by the governor last year. I thought her to be a very well qualified candidate. Her educational background is from the University of Illinois College of Law, as well as from the University of Memphis. She has a very good experience package, including service to the state of Minnesota on the Supreme Court's roster of qualified neutrals and mediators. She also has significant background regarding public utilities and telecoms work as a member of Moss and Barnett, a professional association in Minneapolis. As an attorney, I've had private discussion with her on a number of different subjects. We did have her in committee. I thought she was a very well qualified candidate, very well experienced, and also a good representative of the people, I feel. She has that varied background that I think we need. She's already been serving as Public Utilities Commissioner on some very contentious cases, and I think she has a very well-qualified and open mind to what serves best for the people of Minnesota when it comes to the Public Utilities Commission and its service to our state. So with that, members, I recommend an approval of this candidate.
Further discussion on the OSMIC motion. Senator Simonson.
Thank you, Mr. President, and I want to rise and add our support to Commissioner Means. She has, as has been said, exemplified what we want to see in a Public Utilities Commissioner. Most importantly, the ability to put aside politics and consider the underlying policy. She's very well qualified, well experienced, and I've certainly found her to be very knowledgeable on regulatory issues, and look forward to seeing her continue on this commission. Thank you.
Members, any further discussion? Seeing none, Senator Osmic renews his motion to confirm Valerie Means as Public Utilities Commission Commissioner. All those in favor, say aye. Aye. Oppose, say no. We will take a brief pause to gather the votes of the members in the alternate locations. Receiving a sufficient number of aye votes, the motion prevails and Valerie Means is confirmed as Public Utilities Commission Commissioner. Moving on to the 13th order of business, announcements of Senate interest. Without objection, the following senators will be excused from today's session. Senator Goggin from 11 a.m. to 2 p.m. and Senator Osmic from 11 a.m. to 2 p.m. Announcements of Senate interest. Senator Pratt.
Thank you, Mr. President. The Jobs Committee will be meeting 15 minutes after the close of session, so let's say at 2:55.
Further announcements, Senator Benson.
Mr. President, there were some impassioned speeches last week talking about reopening Minnesota, but one of the things that we haven't spent a lot of time on is talking about the impact of elective procedures. Elective procedures were stopped prudently to relieve the pressure on personal protective equipment and allow training of healthcare workers. But every decision has consequences. Delaying elective procedures is delaying routine care. Our hospitals, clinics, and dentists are losing money every day, and we will not be able to make them whole. One provider lost 80% of their monthly revenue in March. But the reasons for beginning a path of opening up elective procedures aren't about the money, it's about the care of patients. It's time for us to have an open discussion about what it would look like to make elective procedures available. How do we provide access for a child with cerebral palsy who needs Botox to relax his or her muscles so that they can be properly positioned in a wheelchair? How do we manage dental pain in a way that doesn't result in an ER visit? How do we handle long-term knee pain without increasing the risk of an opioid addiction? How do we care for long-term eye diseases normally safely managed with an injection when people are afraid to go in for care? I believe rigorous discussion should be started as to how licensed healthcare professionals working for the benefit of their patients can make a thoughtful plan for reopening some level of elective procedure. It's not about politicians driving these decisions. It's about listening to providers who care deeply about the professionals on the front lines of the COVID battle, but also want to care for their patients. And so, members and to the governor's staff, we have all been engaged in very thoughtful debate about opening businesses. I think it's time to add elective procedures to that list. And I think we need to start listening to the voices of the providers of those procedures so that they can have a plan for how they'll continue to conserve PPE, how they'll continue to train and prepare for COVID response should they be needed in that capacity, but also how they can serve their patients and take care of Minnesotans who are waiting for care. Thank you, Mr. President.
Announcements of Senate interest. Senator Kent.
Thank you, Mr. President. Before I go on with what I originally wanted to speak about, I would like to respond a bit to what Senator Benson just brought up. much the way when we talk about how important it is, and we all agree that we need to open businesses in a way that is safe and get people back to work and get our businesses up and running as soon as we can in a safe way. A big component of that is that we need to ramp up our testing. And I know that Governor Walz and his administration have ambitious plans, working with Mayo, working with the U to try to do that. But we know that that is a key component to trying to open up business in that regard. In this specific case, and talking about elective procedures, I think, and I know Senator Benson and I have been in, she's probably been in many more of these conversations even than I have been. We've been in some of the same meetings. But it was the hospitals, and it is the hospital systems who are facing a lot of pain over the lack of elective procedures. But they were the ones who are advocating to make that postpone, to cease the elective procedures, because they knew of the lack of personal protective equipment for our healthcare workers, and that these elective procedures come with a use of those same pieces of equipment that we're struggling to get a hold of now. So much the way we need testing to reopen a whole range of businesses, we need to make sure that we can secure the personal protective equipment that we need in order to go back. Because I agree, I hear it in my community as much as anybody else does. There are a lot of providers who are struggling, and we need to get this going as quickly as we can. But that's why we need a really strong, coordinated effort to make sure that PPE is available for our hospital and healthcare workers, for our first responders, for people in our grocery stores who are facing risks, just to make sure that we can all put food on the table, and for our providers who would be doing these elective procedures. And we know that these elective procedures are not always completely elective. These are important for the patients. So it is important, I agree, but we need to make sure we have PPE too. Mr. President, the reason I originally wanted to speak was to ask if Senator Gazelka would yield.
Senator Gazelka will yield. Senator Kent.
Thank you, Mr. President. We have had a lot of robust conversations on this floor today and in other days about the importance of jobs and getting people to work. We know how important that is around our state, and we all share that goal and how important it is that we do that. We know that one of the very good ways that here in the state we can put people to work in good jobs, jobs that cannot be outsourced, is through a good, ambitious bonding bill. And so I would like to ask Senator Gazelka if he has any insight, a status update on where we stand in the process as we are now inside 4 weeks remaining in this session.
Senator Gazelka.
Mr. President, Senator Kent and members, I've had a conversation within the last 4 days with Senator Senjum about moving forward with a bonding bill. There's going to be key pieces as we get to the end. The bonding bill will be one. Oversight over the billions of dollars of federal funds will be the second. And the tax delays and relief that we can give to our struggling small businesses that everybody here acknowledges are struggling are the three pieces as we move forward, and I think we'll all have to work together to find the right combination of those three, but it is a priority for me, and I expect a bonding bill to get done this session.
Senator Kent.
Thank you, Mr. President. Well, are there any plans for any committee hearings? Is there a process in place? We have had some conversations among the caucus leaders about trying to get together and work on this together, and I would hope we could continue to have those conversations. But as I said, the clock is really, you feel the clock ticking now that we're inside 4 weeks.
Were you asking Senator Gazelka to yield?
Yes, if Senator Gazelka would yield, please.
Senator Gazelka will yield. Senator Gazelka.
Well, I agree. So let's keep working on it as we get to the finish line. It does take all four caucuses in some measure to pass a bonding bill. I am personally committed to doing that. As long as we focus on key infrastructure, then I believe we'll get one done, and I think we're all talking about that. So thank you for bringing it up again. That's why I'm glad we're meeting every 3 days so that we continue to work on some of these things that need to be done.
Any further announcements of Senate interest? Senator Gazelka.
Mr. President, I move that the Senate do now adjourn until Thursday, April 23rd at 11 a.m.
Senator Gazelka moves that the Senate do now adjourn until Thursday, April 23rd, 2020 at 11 a.m. All those in favor say aye. Opposed say no. Motion prevails. The Senate is adjourned.